Good afternoon, everyone. How are you?
Awesome.
Awesome. I heard when you are nervous and you should start a big event, you should start with a joke. Andrea told me, just tell a joke. And I told her, I'm just going to leave that to Gabe Farias. He'll do a better job. But speaking of Gabe, this is actually his brainchild. This event, the State of Medicine, a special edition of the State of Tri-County, was originally planned by Gabe last year, and he said, Shanka, why don't you do all the work next year? Very smart Gabe. But we made it happen. And I am very, very excited that we were able to fill the room in a socially distanced manner, and that we were able to also set this event up in a way where we live stream to many Facebook pages, but also to our first ever event app. And why is that important to me? Because I believe that if this chamber learns to establish a strong presence online, it can not only help its members that are able to attend in person, but the entire region, the Tri-County region, and who knows, maybe even the entire state of Texas. So let's all embrace technology. The event app, if you haven't downloaded it yet, you can just scan the code, the QR code that's in front of you. And there's actually a reason for you to do it. A few reasons, actually. First one is that in the networking section, in the bottom right corner, you will be able to connect with people that are attending this event during and also after the event. Up to 1 year, you can keep networking with each other. The second reason you should take a look at the app is because there is exclusive content in there that we have only made available inside of the app. You will find helpful PDFs. You will find details about the sponsors, the panelists. You will find a white paper that was specifically written by Dr. David Wiequist for this event. 5 trends in healthcare for healthcare businesses and also people who are interested in investing in healthcare businesses. Finally, we all like some good giveaways, and this time, if you want to be in the pot, it's in the app. If you have created and downloaded your app, we will be able to draw from those names later. We have some nice gifts over there. Tri-County offers a golf swag bag, a total value of $250, a free hole sponsorship, and other golf goodies. We have Zavaya, ZSG, who is giving away an Echo Dot. And we have the Randolph Metrocon Rotary Club, who has a bag with gift cards, $65 in value. Net Women Marketing, swag bag, we know they're always worth it, with a gift card of $25 for Nietzsche's. And then there is that a second gift bag, also by Net Women Marketing, with another gift card of $65. There we go.
And we also just received a 2-night stay from the Hilton Garden with breakfast.
Woo! Thank you. Awesome. Okay. When I first came to the United States in 2011, my friends and family said, "Why are you doing that? You're leaving this wealthy country, Luxembourg, to go to the United States where healthcare is not all that good, you know? We have universal healthcare here and we're a single payer system." And I said, it's not gonna be that bad. I went to Miami University, Ohio, and my first experience with the healthcare system was the following. I had the only insurance product was student health insurance. And when on one fine day I had some back pain that I wanted to be looked at, I went to the student health center and they quickly sent me to the local hospital to get an X-ray done and an MRI. And after about an afternoon of long waiting and some procedures, I walked out with a $7,000 bill that my health insurance would not cover. And that was when it dawned on me, maybe people at home were right. There is something that can be done to improve the situation. And I decided that I would adopt the American method, which is Americans like to find creative, entrepreneurial, innovative ways to improve their situation. And we all do that in ways where we can use our skills and our knowledge to best achieve that goal. And in this very room today, we have a lot of companies, a lot of individuals, a lot of experts who each contribute in their own way. And therefore, it's very beautiful for me to see this moment today where all of that culminates for me. I also decided to base my own company's focus on solving this problem in a way where I could apply our expertise in web development, in marketing, in IT. And I am actually very, very proud to highlight a few of the companies that are here today that are also Shanks Web Development customers, such as our event sponsor. Thank you so much. New Choices Treatment Centers. In the back of the room, Jason Turner and Tamara Lohman. Very, very grateful. Thank you so much on behalf of the Chamber for choosing to sponsor this event. SureMed EMS, which is the live stream sponsor. Do we have Pete Costco in the room? No, he's probably watching the live stream. Let me tell you about SureMed EMS, an emergency transportation company based here in San Antonio that embraces technology in a way that, according to him, is quite unique in Texas. They have something called mobile integrated healthcare, where their EMTs, when they are dispatched, they use technology, telemedicine technology, to gather important data that lets the EMTs make decisions on site that otherwise would require the involvement of a medical doctor. And like this, they can solve a lot of problems and save time and cost for their companies they collaborate with. Harlan Pickett Health Insurance Broker, our snack sponsor today. Another website done by Shanks Web Development, and then a direct med clinic with Dr. Roger Moshigemba, one of our panelists today. Also, website marketing IT done by our company. I'm very proud, really, and if you have ever wondered whether you could get some references from our work, today is the day to speak to people in the room. I also want to give a huge shout out to all the other sponsors that are not our customers, mainly because what they have is so good that even we can't improve on that, really. And that would be Physicians Premier ER Services. I had a talk with Dr. Schwertlich, although I know that there are several doctors involved, but we spoke about something that is very pertinent in today's healthcare ecosystem, which is something called appropriateness. And that means that when you see someone in the ER and they really trust you with your judgment and what you advise should happen, that you choose appropriate measures and appropriate procedures that don't cost too much. So Physicians Premier ER is a company that embraces this and that wants to make sure that when you see them, only what really needs to be done is done, which I think that is very, very, very important in today's health ecosystem. John Sand, our I think drink sponsor, yes, they are in home health, and I hear that they do a phenomenal job making sure that they can accept almost any insurance product out there, as well as they have set themselves up to really collaborate with the VA nicely. And I'm told that is really an accomplishment in the home health industry. So thank you for all these companies to support our event today. I want to talk a little bit more about New Choices, the main sponsor. I have a strong connection to addiction because when in my previous career, I worked as a law enforcement officer. I was stationed at a railway district at a red light district at a railway station. There we go. And my very, very first day, I was called to a moment where a woman had jumped into a 15-foot ditch. And the reason she jumped down is because she had lost her drugs and that had fallen down, and she jumped after him to get the drugs. And the fall had caused both of her legs to break. And this is just something for you and I that's really hard to conceptualize, right? That someone would do that. But someone who's fighting addiction, they're willing to do whatever it takes to get to those drugs. And I remember the EMTs and the fire department were helping us to lift the lady out of the ditch. And while we were doing that, guess what she was doing? She was shooting that stuff in her veins, right? So that was still a priority. That same week, I got to perform my first arrest. And there's a lot of paperwork that needs to happen, and we have a cell inside of the station where people are contained during that moment. And the lady tells me, I'm really bad. I'm feeling withdrawal symptoms. You gotta hurry up. So I did what I could. I left the room briefly, came back, and she had found an old syringe of a person that was previously in that cell that was hidden in between a small space between a bar and the floor of the cell. And she filled that syringe up with her blood with the hope to use the residues of the drugs that were in there and shot it back into her body. The last example that I remember from that first week is a family father who was a professional driver. And the court had mandated him that he could not drive under any alcohol percentage in his blood. And the person cried in front of me because his alcoholism was advanced in a way where without alcohol in his blood, his hands would tremble and his vision was blurry. So they couldn't provide for his family without not being on the right side of law. And I remember that back then I thought to myself, wow, there's really no way out of this. When you work on the repressive side, you don't see those people that make it out of there. But I can tell you for sure that it is possible. It really is possible. But you need facilities like New Choices who do very, very hard and important work to help an individual get out of addiction into recovery. And we all have people within our friends and network and relatives that are impacted. And I just want to kind of emphasize that it requires a wide range of skill sets 24/7 to run and make a facility like New Choices happen. You need admissions people, you need counselors, therapists, you need medical professionals, you need management. And it's really, really important to have people who are dedicated 24/7. Why? Because very often when people are in process of being helped, they want to give up. They want to give up late at night, early in the morning, in the middle of the night. And the staff needs to be willing to immediately intervene and talk and try to get that person back on the path of recovery. That is what the people at New Choices do. I just see it all the time because we help them 24/7, and it's just such a pleasure to see that there is a group of people who is willing to do that. You know, New Choices is a wonderful place because it is right in San Antonio, and when you look at it from the outside, it really looks like a place where I would have a staycation. It's really luxurious apartments, nestled in nice green entourage. But in there, a lot of important work happens. And you can only imagine what kind of individual it takes to run such a facility. It needs to be a very, very passionate, energetic person who is totally invested. And this person, you get the pleasure to meet here very, very soon. When I met Jason Turner for the first time, I was really overwhelmed by his energy. He's a force of nature. And he has himself walked the path that he will probably share with you. But it is at this point my absolute pleasure to welcome Jason Turner to the lectern so that he can share with you what New Choices can offer to this community. And I want you to really connect with him after his speech so that you can all take advantage of the amazing services that New Choices can provide. Jason?
Good afternoon. I was feeling pretty okay until that last part that Shankar was talking about, man. I said, ooh, okay, I gotta get energy, and now I have to, I gotta show up, you know, and I have all these expectations on me. And I was reminded that really I'm here today to kind of talk about, introduce, I think, everyone here. And I also found out 3 minutes ago that it's being streamed live on social media. So I was like, oh, that's even worse for me to hear. But, you know, I just remind myself that I'm really here to talk about the people that we get to serve. I feel privileged and honored on a daily basis that I get to serve this particular population. I think it's really important as far as the stigma reduction goes to talk a little bit about how I see the substance use disorder population, how New Choices sees it. Full disclosure, this is my first time out in public in a while, so it might get a little awkward to feel like this is sort of a new environment for me. I've been, like most of us probably, I don't know how many events you've all been to, but I haven't been to any in quite some time with the pandemic. And So I'm grateful I get to be out in public. It feels like things are starting to shift a little bit in this kind of dark period that we've been going through. And I was reading a little bit of information prior to the talk that came across my feed, and it was talking about the percentage increase in mental health situations, overdose deaths as a result of the pandemic, and the numbers are staggering. You know, so this is definitely an area that I feel pretty solid. I feel really, really committed to finding better, improved ways to help this population, and that's what I think we need to do here. And like Shankar said, we're this local, right in Alamo Heights, really cool spot. And New Choices is what brought me to Texas. I'm a person in long-term recovery. I have a social work background. I was brought here to bring a process that I had introduced several years ago to some other programs, where sort of blending neuroscience and psychological principles along with physical activity and movement. And so they asked me to come and develop an IOP here that was built on that model, where people got to move and be sort of in a, kind of looks like a CrossFit gym, but it's really what we actually called it the group room. And it's where a lot of therapy happens. So I came here a year and a half ago, developed that process, implemented that outpatient center, and then I left, and through a series of events, you know, this is why I think it could be a little awkward. First time out in public, I just took over at New Choices about 7 days ago as the CEO. So the beauty in that is I'm familiar with the organization, I'm familiar with its mission and kind of the ways in which it wants to serve this population. And on day one, Shankar was helping me with some IT stuff and doing what he does, which he does a phenomenal job. And
he said, oh, by the way, yeah, there's this talk at the end of the month, and
you know, you have to be the presenter organization. So this is the most awkward slide of the whole presentation, so we can sort of get off of that. But I am, like I said, I'm a social worker by education. I was in the Air Force, and I was offered this scholarship, which I still sometimes to this day think, I don't know kind of why they chose me, but I'm really grateful I get to be part of the Tillman Military Scholar Foundation. And now I get to represent New Choices as a leader and help this team grow. So with that being said, we can move past that. So I just went a little bit. This is a video testimonial, right, that we have. I'm just gonna let this video play and then we can continue.
My life before I got to New Choices was just miserable. I was helpless, I was hopeless, I was in a terrible state of mind. I was extremely isolated over the last 10 years. I really had lost and gained and lost friendships, and the last 2 years before I came to New Choices, I had basically lost all my friends. I had lost the relationship I was in. I was on the verge of losing my apartment, and I had lost my job. And I didn't know that there was a solution. I really was in this alcoholic hell where I couldn't stop drinking, and I didn't want to drink because I got into trouble and drinking wasn't working for me. And the most important thing for me was to keep an open mind and listen. And I had come into here with such a broken man that people were saying there is a solution and there's a way to get better and a way to stop drinking and a way to be happy and peaceful and achieve some serenity in your life. And I didn't believe them at first. And it took other people and peers and counselors, specifically at New Choices here, that related to me and said, I've been where you are and I have a way out. New Choices stabilized me at first, and through the 30 days here, I learned how to live life. They taught me what it is to be a 30-year-old man and how to communicate effectively, how to ask for help. They gave me tools. I remember when I left New Choices, I said the word love or hope or something like that. And I remember saying, oh, if Eric from 30 days before that had heard Eric now, he would throw up. He'd be like, who's this guy talking about hope and love? That wasn't me. And now it's my guiding force in the universe. I just try to bring love and hope into what I do. What I'm most proud of in my recovery is keeping an open mind and listening to what New Choices had to tell me. The people, the friendships I made, the guidance that I received, particularly from my therapist. We did a mode of therapy called cognitive behavioral therapy. And I got so close with my therapist, even over just 30 days. And it took a lot of work, but she gave me the tools to look inward and uncover and discover what's really driving my behavior. I didn't tell anybody I went to New Choices because I was afraid. I didn't want them to know who I was. I thought it was a real shameful act. And it turns out that it's the complete opposite. It takes a lot of courage and a lot of faith to do what I did and go to New Choices and seek help. I think real growth comes from acknowledging you have a problem and addressing it. And to shed the idea that there's any fear, you should have any fear or shame attached to this thing. It's really powerful to go and acknowledge your problem and go get help. And New Choices is the place to do it. I would tell the person still struggling with addiction that there is hope and that there is an answer. I didn't know that there was, and it caused me a lot of pain and a lot of suffering. And I got really lucky and really fortunate that I got into New Choices. It was not something on my radar. It was fate through the universe that I came here and found a solution. But to the person who's still struggling, there is a solution. And you don't have to feel this way forever. There's a way of living through New Choices that you can be free from addiction and free from that torment in your mind. And you'll learn how to cope and deal with your emotions and gain some serenity. That's all I want in my life, is to have some peace of mind. And I was really able to achieve that here.
I think what stood out to me in that video, and I got introduced to that young man last year when I was here, the idea that it's weak to ask for help, that it's weak to show up at a doorstep, and really, there's so many things that are wrong with that mentality. What it takes to say, hey, I have this issue and I need some help. And not only do I need help, but I'm going to stick with this process, this 30-day process, which I believe, and I think everyone that gets to
Observe this population would agree. The 30 days is an opportunity for us to clear away some stuff, stabilize,
introduce some new processes and some ways of thinking and really hear the person out, and then the work begins in the real life out in the outpatient. When we leave our residential treatment center, we also have an outpatient service, and in the community, right? So for this young man to be going from this place of like never hearing the word love, never using that, and seeing this idea that we are weak, and then we get to step into this place of being strong, and that piece really stood out to me, and I'm grateful that I got to see that today. Our program is based, it's not much different than a lot of things that are out there, as far as we have, solid place for our clients to, an environment of care that is conducive to the trauma work that we do. We use EMDR therapy. We have
evidence-based treatments. I just brought in an entire new medical team on board. We're introducing.
In the field, I hear a term called medication friendly or MAP friendly. We're really bringing in medication assisted treatment, where patients can qualify, get introduced to that in our residential treatment center, move into our outpatient center, and be seen by a provider post-residential treatment so that they can have their medication-assisted treatment needs met if necessary. Which I think for us is really important because as I look at what's happening in the treatment industry and with the opioid crisis and the situation with our, I guess what I'll just say is sometimes the personal biases of abstinence-based treatment have actually get in the way of what
Really needs to happen on a medical level.
and so at New Choices we really want to change that game. I think, going back to what I thought I really wanted to focus on today was the people and that idea of being weak, coming to treatment, and the stigma reduction. Here's the way that I see our population, and it's the way that our staff see our population. It's the way that Tamara sees our population. I see the substance use disorder sufferer as probably one of the most resilient, capable, creative survivors out there. I think when I look at what our population is able to accomplish with something like addiction in their life and still be able to survive and come out the other side, there's really no other way for me to see them. And I think when they come into our process and they get introduced to our program, the messaging to them right away is like, I don't look at you as broken. I look at you as having wounds that need to be healed. I don't look at you as weak. I see you as resilient and strong. And I think what happens for a lot of people in our program is they begin to see themselves differently as a result of that messaging, as opposed to you're this dishonest, self-centered, selfish person who made choices and brought this upon yourself. We start to introduce things like neuroscience and how this thing affects the brain and how the nervous system is involved and how choice is compromised on a daily basis through this process of addiction, and how really you've been wired for survival, and it's been this survival instinct and this process within your body that has been manipulated and you've been taken over by this process. And I think a lot of people instantly feel relief when they start to hear that messaging, because it's like it goes from this place of like, I'm not this bad person trying to become good. I'm a sick person who needs to be treated and cared for. And I think that's one of the biggest pieces to what we do that really helps people change. I always talk to the staff and I say, this idea of being heard and validated in life is so important. And I think oftentimes I've seen patients in different parts of the country where I've been. I've seen patients be talked down to. I've seen patients become not validated whatsoever, and I've seen their concerns get totally dismissed based on the fact that they're substance users, and that's just what they do. They lie, they cheat, and they steal, and they have this motive that's negative, as opposed to a situation that really needs treatment and really needs support. And so, that's at the core of what I want to bring to the table for this local community here in San Antonio as we begin to sort of make connections. And part of sponsoring this event and being here for me is about connecting more with the medical side of the industry that we're in. I think there's a really powerful process for people with things like 12-step recovery and holistic treatments, but there's also a real need for, I think, us to really seek out solid medical protocols and bridge the gap between this behavioral health side of things that treats substance use with people in the medical field. And I want to be that. I want us to have a strong relationship with the people in this room, with the people that are not in this room and couldn't make it today, with all the people on Facebook who are currently watching this. It's something that's a real solid goal of mine. We have continuums of care. We have the ability to detox. We have the ability to treat somebody inpatient for residential treatment. We have what's called PHP, or partial hospitalization, where we can do a day treatment program. We also have our outpatient center, which is located up by 1604 in Rock Hill, Selma, in 1604. We have, we can go on to the next one. Some of the evidence-based processes that we use: cognitive behavior therapy, EDT, dialectical behavioral therapy, EMDR. We're using that to treat our trauma. We're also utilizing somatic experiencing, and obviously physical movement is something that I personally believe in. I've seen it work incredible with this population, and so we incorporate a lot of that. All of our RTC or residential patients get to experience the outpatient center where we have personalized trainers who work with them on a one-on-one basis and in a group setting, so that they get the opportunity to engage in utilizing physical movement to help with their mental health. I think anyone here who's ever sort of been in a situation where you get to go on a run, or are there any runners in the room? Yeah, so you might know what I'm talking about, where you go for a run and it seems like the whole world changes by the time you get done. So we're utilizing that process in the brain and that neurochemistry to help our patients get through the stuff that you heard Eric talk about, which is challenging days and having to take a serious look at yourself. So that stuff is really exciting for me. Here's an image from inside our outpatient centers. That's some of the stuff I just touched on. This is our like a front of one of our apartments. So in our program, rather than have one sort of main central area for people, we have separate apartments. So 2 people share one apartment. And what we're creating is, at least trying to do to the best of our ability, is we're creating this opportunity to mimic as much of real life that you would experience before coming into treatment. So having your own space, not having to be sort of crammed into a small space with a bunch of other people, and be able to, our therapy sessions are conducted inside the client's apartments. So we meet the patients where they live and reside.
When I came on board last week, I had promised I wasn't going to make too many changes right away, but then I made a lot of changes right away. And
so one of the things that I asked all the clinicians to do, and when I brought it to them, they instantly got it. And that's what I love about this team at New Choices. That's the last piece I want to talk about before I close today, is that I brought it to this team of people. I said, hey, I want you guys to do sessions in their apartments, and this is why. I want you to see where they're residing. I want you to see the photos on the wall. I want you to be able to see how they're living, so that can impact some of the stuff that you're going to talk about in your sessions, and the way that you're going to help them process through the stuff that they're here to process. And we allow them to have their cell phones, and sometimes that's looked upon
sort of not so, that has some
negative connotations in the industry, but I see it becoming more and more common. My thought process on that is basically it's 2021, and cell phones are a huge part of this whole process. And the way that our cell phones impact our neurochemistry is incredible. And if I take that cell phone from you for the 30 days that you're with us, and I don't allow you to have access to it, and I do all this amazing therapy, right? And I give you all these amazing tools, and at the end of that 30-day process, I hand you this contraption that is going to override all the stuff in your brain. I'm setting you up for failure. So what we've introduced is a process where each of our patients, we're given 2 to 3 individual sessions a week if necessary. 2 of those sessions are based on clinical processing and some of the stuff that they might see in the apartment. And the third is really for this aftercare process. We meet with a therapist and a case manager, as well as discussing things like, how did your phone affect your life this week? How was your mood affected by the way that you used your phone? I think it's really important for our patients to
to us to be introduced this the ways in which the phone impacts mental health. How when I scroll on social media and I see all of the best parts of everyone else's life and it looks a little bit fake, right? And then I end up internalizing that, and I have this process that goes on in my head, and then I have this response of whether it be depression or feeling down, and then I go and do something to counteract that. Maybe I'm not using the chemical that I went to treatment for, but I'm using some other form, right? Drugs and alcohol come in lots of forms, things like Amazon and other ways that we kind of handle our emotional well-being. So we're trying to highlight our patients all those in which our behaviors impact our mental health and how we can overcome those. So
That's something that I'm really proud of the team for accepting, because when I told them about the phones, because they hadn't had access to the phones prior, the look on the it was like the total opposite, right? The patients were like really excited and the staff were terrified. But I think Tamara would say it's going pretty good right now. So the last thing I want to talk about, and I think alumni is a really important piece of our program. Keeping people connected. We use our gym for that. So when people leave our facility and we have case managers that stay in contact with them, we're introducing technology too. So I want to use that phone for something other than being distracted on social media. We're introducing an app that helps, it'll connect them to a provider. It will, we can reach them through, it's all HIPAA compliant. So basically what will happen is our case managers, clinicians, and our doctors have access to our alumni through the app. And then they can do sort of personal chatting in there. The alumni can talk to each other, and we can schedule appointments for them that enter into their calendar from a quick response. So really trying to utilize this concept of the fact that our patients are on technology quite a bit, and it's just that it's where things are, right? The people at New Choices, the staff and the clients or the patients, I refer to them as patients. I'm getting used to the word client. The staff are absolutely phenomenal. I just need to share because it's something I have to do for myself. Having entered this system in the last probably 8 to 9 days and watching the staff model the behavior of accepting the change process, of looking at new systems, of acknowledging, hey, yeah, this is stuff that will make us better. This isn't what I'm familiar with, but I'm willing to step process in a healthy way for clients who are coming from families and backgrounds who may be dysfunctional, right? So as a staff, we get to recreate those relationships, and for me, they have done a tremendous job. So I really just want to say thank you to the staff at New Choices. And I guess that's the final slide. This is our yoga room. We do yoga on site. And I want to thank Shankar
asked me to talk today. I feel like I fell very short of your force of nature comment, which will be bothering me all day today when I will have to do some work and maybe call people to get over it. But I want to thank the room for being here. I want to thank you for allowing me to share my experience with this organization from last year to now. The fact that there's a lot going on and we're managing on a day-to-day basis and providing the highest level of quality care is super impressive to me. I look forward to attending these events in the future, being part of them. I welcome anyone to sort of ask any questions after this is over, and I really appreciate whatever that may be. So I just want to say thank you to everyone. I appreciate allowing me to take the opportunity.
Thank you, Jason. Use this here. I was playing a little bit with the app. I already matched with a few of you. Oh no, wait, that's a different app. But it's similar though, right? You swipe right and left. Nice. By the way, the app is sponsored by Callum Family Medicine. I was not surprised when I heard that they were going to do that because they are into telemedicine apps. A little bit more about that later. How do you like our signage there and your notepads given by Leapfrog Promotions? Thank you very much, Leapfrog. And how do you like this amazing location? Sponsored by the City of Live Oak for us. Thank you so much also to the city. I was looking for a person who could give a speech that lays the foundation of the panel discussion that we are about to enjoy. And we were thinking, the board was thinking, and I was like, wow, that needs to be a very, very knowledgeable individual. Well, who else than Michael Beaver, the CEO of Northeast Methodist Hospital. I think they say Methodist Hospital Northeast. I always say it the other way around. Now, whenever you have to introduce someone, you go and look at their LinkedIn profile, which, by the way, Michael, you still need to accept my request there. And I saw, wow, this guy has 20 years of experience in this field. He is a studied healthcare administrator, and he is also a doctor. I spoke to him briefly over the phone, and I was really astonished how well he was able to talk to someone like me about certain challenges that you encounter when you have to lead a hospital. I have to lead a small company, less than 10 team members, and he leads a hospital. And also, and I think that says it all, they have been nominated as one of the best hospitals by your SA Reader's Choice Awards. Congratulations for that, Michael. I hope you will win. I know the chamber voted a lot for you, the chamber members, and I believe the results will be published on Thursday. But please see for yourselves as Michael Beaver introduces the topic of the state of medicine to you all. Michael?
Can y'all hear me okay with that? Okay. So Jason, I feel your pain with the introduction, so I understand where you're coming from. Again, thank you for being here today. I'm really pleased to have the opportunity to visit with you about the very broad topic of the state of medicine. So, when I thought, okay, when I'm going to talk about the state of medicine in March 2021, wants to hear about COVID, but COVID is the backdrop for everything really of state of medicine in 2021. So I'm going to start with that and kind of lead into some other topics today that I think will set up the panel discussion later. So I'm going to give a little bit of a COVID overview. I want to talk a little bit about where we are right now and what is going to happen next. I want to talk about some very specific healthcare concerns post-COVID that can impact you and will definitely impact this community. And then I want to end with just talking about some emerging business trends that I think will again set up the panel discussion. So where are we now in the U.S., in Texas, and more importantly, right here where you live in the Tri-County region? So I know some of these numbers are going to be hard for you to see, so I'll kind of walk you through them. But in the United States, or actually in the world today, there are 124 million COVID cases that have been diagnosed. 124 million. And 2.7 million deaths across the globe. Here in the U.S., we've had 30 million cases. Now that's noteworthy because that's about 25% of the global count right here in the U.S. I'm pleased to say that after our peak in January, we've seen the numbers start to come down, and we've had a nice trend for the last couple of months. In late January, when we were peaking across the entire country, we were seeing about 275,000 new cases every single day. That number right now has dropped between 55 and 60,000 per day. In terms of deaths, in the United States, we've had 540,000 deaths so far. That's about 20% of the international count. So the United States has the most cases and the most counts. And when you break it down and you look at on a population basis, because we're a much larger country than a lot of places, how do we compare? We still don't compare very well. There are a few European countries that are in a little bit worse shape than us. Interestingly, the Czech Republic is one, Italy, UK, a couple others, but we are right there among the countries across the world that have been impacted the most. The deaths also trending down during the peak, about 4,300 deaths per day. That number's down to about 1,200 per day. Still a significant number, but again, a big drop over the last 2 months. As we've seen this number drop in the last couple of months, we've reached a point of a plateau, and it's actually starting to go back up a little bit in some areas. We'll talk about that in just a moment. When you look in the United States about who has been most impacted, there's clearly some disparity in different segments of our population. The elderly, people over 65 years old, account for more than 80% of the COVID deaths. So clearly has been a disproportionate impact on the elderly. And also some racial disparity. So first on the ages, if you look at the top graph, I know those numbers are hard to read, but the really long bar at the bottom shows the mortality rate for people 80 years old and over who contracted COVID. It's about a 15% mortality rate for 80-year-olds and above. That bar right above it is people in their 70s, and it cuts it in half, but it's about 8% mortality. The bar above that is the 60s, it's about 3.5%, and then you see it goes on. So when you get to the younger population, that mortality rate is much, much smaller. In terms of racial disparities, if you look at the table in the bottom right, this uses white, non-Hispanic Americans as the baseline. So in terms of prevalence, a white non-Hispanic person would have a 1.0% risk, so an even risk of getting anything. Compared to Black Americans, the likelihood of contracting COVID, it's 1.4 times more likely. Hispanics, 1.7 times more likely. In terms of hospitalization rate, even more shocking. For Black Americans compared to white, 3.7 times more likely to be hospitalized, and for the Hispanic community, 4.1 times. And if you look at mortality, for African Americans and for Hispanics, 2.8 times more likely to die from COVID than if you were white. So some significant disparities there. Early research, a lot of it focuses on socioeconomic reasons, which certainly can be a contributing factor. There may be some other genetic components to that we'll probably learn about over time, but I think we're potentially years away from understanding really all the impacts there. When we think about our home communities, what's happening here? So I use those same numbers from the U.S. as our baseline. So if you look at the table on the top, that's the number of cases across the U.S., and then in Texas, and then if you break it down to each of the tri-counties. And so it's kind of hard to think about a huge number like 30 million cases. So if you break it down to how many cases per 100,000 people, it's a little more digestible. So it's about 9,000 COVID cases per 100,000 people in the U.S. If you break it down a little bit more to how likely are you to get it?
In the U.S., 1 out of every 11 people has contracted COVID.
So if you just look at the colored circles, it gives you an idea compared to that U.S. benchmark, how we're doing here in Texas and in the individual counties. So if it's yellow, we're doing about the same, roughly the same as the national benchmark. If you see red, like that Bexar County number for cases, we're actually doing worse than the national average. So in Bexar County, one out of every 10 people has contracted COVID, compared to the national average, 1 out of every 11. Guadalupe and Comal certainly have far fewer cases, but you can see they're actually both doing a little bit better when you look at it from a population standpoint. So Guadalupe County, 1 out of every 12 people has contracted COVID. In Comal, it's only 1 out of every 16. If you look down at the deaths, it's a little bit different story. Texas and Bexar County both doing about the same as the national average. Roughly 1 in every 600 to 625 people are dying from COVID. If you look at Guadalupe, they did well in cases. They're also doing well in deaths. It's 1 out of
Every 838 people,
For some reason, Comal is not doing as well. So even though the cases are a little bit less, 1 out of about every 500 people in Comal County has died from COVID. It just kind of gives you an idea of how we're doing in our local community. So again, you see a big disparity just because of the population of Bexar County compared to the other tri-county communities. So I'm going to show you some data on the next few slides that is Bexar County data, but the idea, the trends that we experienced in Bexar County are pretty similar to what you experienced in Comal and Guadalupe at about the same time. This first one right here shows a graph that is the testing probability or testing positivity in the community since the beginning of the pandemic. And you see two big spikes. The first spike was the spike we had in this community in July, and the second one is the one we had in January. And so the testing positivity, so the percentage of people who tested positive during both those spikes peaked at around 23 or 24%. Pretty high. If you look down here at this red line at the bottom, that's actually your goal. You want to be at less than 5%. Now, I'm pleased to say that the new results came out yesterday for Bear County, and it's back down. It's actually about 2.3%, which is the lowest it's been in a very, very long time. So it gives you an idea of kind of what that positivity rate looks like.
But at the second peak, we were doing a whole lot more testing than we were the first peak. So what that translated to was a significantly greater number of cases during the second peak in January. So it almost doubled in terms of the number of cases from the July peak to January. Even though that number doubled, when you look at this one, it tells a little bit of a different story. So this is a really busy graph. If you just look at the one that peaks the most, the green one, the green line, that is the hospitalizations, total number of hospitalizations in Bear County. I'm a little biased because I run a hospital, but I think this is the most important statistic other than mortality. Because when you're talking about bending the curve and you're talking about COVID overrunning the healthcare system, this is the concern, is that if the hospitals get so full of COVID patients they can't continue to take care of all the other patients, they continue to have needs for oncology or heart attacks or strokes or any of the other things that a community needs. So even though we saw the number of cases almost double, we only saw the hospitalization increase by about 20%. And I believe the reason for that is because we were doing so much more testing, we were capturing a lot of cases that didn't need to be hospitalized. But during this second peak, 2/3 of the hospitals across the country indicated that 20% of their beds or more were busy housing COVID patients. I can tell you in Bear County during that time period, I guarantee that number for most hospitals was well over 30% and up to 40% for many of them. And I can tell you for our hospital, that's the range that we were in. So very significant impact on the hospital's ability to provide care for their community during these spikes. This last one shows you the mortality. Now, even though hospitalization increased by 20% during those two peaks, the mortality actually decreased by 28%. So why would that be? Well, that's because at the beginning of the pandemic, this was a brand new virus, and we really knew very, very little about it. We have been able to improve our treatment regimens significantly. We've learned a lot from other places across the country, what's worked and what hasn't worked, and we're in a much better position to be able to care for those patients today than we were with the original surge. If we were to see an additional surge here, which could happen, we'll talk about that in a little bit, I suspect that that trend line would continue to go down for a variety of reasons, but I think that we're in a better position to be able to curb the mortality rate of COVID patients. So what happens next? I think there are three keys to this. It's vaccines, it's variants, and it's public perception. So let's talk about the vaccines first. So vaccines really have been a race for immunization. As we have seen the vaccine rollout increase, we've seen the variant prevalence increase at the same time. So over the next several weeks, there's going to be a battle. Which one can we get through? The initial rollout of the vaccine was marked by some significant challenges with supplies and logistics. Everyone's familiar, we had Moderna and we had Pfizer. Pfizer in particular requires an ultra cold storage treatment that's very difficult to maintain. So we had to figure out how to get these across the country, how to roll out the vaccines very quickly, and it didn't go as quickly as any of us would have liked for it to go. It has gotten much better. Before President Biden took office, he declared that he had a goal of having 100 million vaccines in his first 100 days. So that's about 1 million vaccines per day. That sounded pretty good at the time, but before he even took office, the Trump administration had already actually gotten it to 1 million doses per day. So Biden stepped it up and said, well, we're going to try for more than that. We'll try to get 1.5 million. Well, I'm pleased to say that we're already about 125 million doses across the country. Right now, we're doing about 2.5 million vaccines per day in the country. So we have really been able to create a very robust system across the country to be able to get these vaccines in arms. About 81 million people have received their first dose. That's about 25% of the total population. or about 31% of the adult population that's eligible. So that's not bad.
If you add that 81 million to the 30 million people that have already had COVID, you're starting to get a sizable number of people in our community that have had exposure and should have some antibody protection. About 44 million people at this point have received either both doses of Pfizer or Moderna, or they received the Johnson & Johnson one-shot vaccine. So about 13% of the population, roughly 18% of the adults in the population. There's even growing hope on the horizon. As we get further and further into the vaccination, we're actually growing in our confidence about the efficacy of the vaccines that we have. They very much appear to be working. There was a lot of concern early on about the different variants that we knew about, and would they be able to treat those? And it has indicated, at least at this point, to be able to block the UK variant and some of the other variants that we're concerned about, so we're very pleased with that. So a lot of concern early on with pregnant mothers and what would happen in terms of transmission to their babies. And it was just released this week that the first baby born with antibodies from a mother who received a vaccination was identified. So that's really positive news for pregnant mothers who receive a vaccine, that their babies can have some of that protection from them as well. So growing confidence in that. Johnson & Johnson is really important for us because it's a single dose vaccine, and more importantly, it does not have the cold storage requirements. So particularly as you get out to rural areas that don't have the level of sophistication, Johnson & Johnson can really be a difference maker for many of those communities. Unfortunately, their rollout has not been as quick as it's supposed to be. They're supposed to have 20 million vaccines by the end of this month. It doesn't appear that they're going to get there. But I know they're trying some creative things, teaming up with Merck to be able to get there. So I think they'll catch up over the next few months. It's just not off to the start we had hoped. You may have heard about AstraZeneca. It is likely they will be applying for emergency use authorization here in the next couple of weeks. If you've been hearing about it in the news recently, it hasn't all been great because they're using AstraZeneca in Europe. In many countries halted the distribution because there were some questions about blood clotting with patients. The science seems to have resolved that issue. Most of those countries have started using AstraZeneca again. There's still some questions. They've got to clear up on their data here, but I expect they could be another option available for us sometime in the next month or so. In addition to these, there are more than 200 other vaccines in some stage of development right now. So as the virus continues, and we're going to talk about mutations and variants, there will be more and different vaccines available here and across the globe over the next several months. So when you talk about variants, the question is, will we have another surge? You know, are we past this? Are we going to have to do this again? And the question really is about herd immunity versus vaccine hesitancy. So you've heard the experts talk about herd immunity. They believe we'll reach that when 70 to 90% of the population has antibodies either from a vaccine or from having the virus itself. So we clearly have a ways to go. The question whether or not we get there is actually about vaccine hesitancy. So I mentioned earlier at the beginning we had a real issue with supply. We didn't have enough supply. Everybody wanted a vaccine, nobody could get it. We tried to log in. At the Alamo Dome, they had 9,000 visits one of those first weeks, 9,000 appointments ready. They sold, or they booked in less than 10 minutes. It's going that quickly. Then great to have that many people interested in it, but that is going to flip. So pay attention, because over the next few weeks, we're going to be hearing less about vaccine shortage, and we're going to be hearing more about vaccine surplus. Because as we're ramping up to have 2.5 million vaccines available every day, we're going to hit the point where everybody who really, really wants it is going to get it. And you're going to have a lot of people who are a little more hesitant. The true anti-vaxxers really make a pretty small percentage of that. It's the people who just aren't sure yet. They want a little more time, they want a little more evidence. Last week you saw a lot of states across the country say, we're going to start opening it up to everybody. And the reason why that's happening is because they weren't filling all their vaccination slots. Now, if you check your news feed today, Texas just announced we're going to do that next Monday. So it's going to be available for all adults starting next Monday. So I think that'll be great because I think we will have a rush of people and we'll be able to get a lot of vaccines done in a short period of time. But we're going to hit that vaccine hesitancy tipping point. And that'll be the time, if you've had your vaccine, like me, you want to encourage your friends and family to go get the vaccine because that's what's really going to make a difference in order to be able to get us over that hurdle. In Europe, you've probably heard about the surge in the lockdowns they've had there. It's largely due to that UK variant known as B117.
It is far more contagious, 56% more contagious, which they've known for a while, but now they believe it's also 60% more lethal than the original coronavirus. So a lot of concerns about the UK variant. That's the one that is expected in the US to be the dominant strain over the next few weeks. So I mentioned earlier that we are seeing the trends decrease from the peak. We're seeing it flatten. Just over this last week, 27 states reported an increase in cases of 5% or more. That's pretty significant. I want to point out Michigan because they're kind of interesting. Michigan is doing incredibly well in their vaccination rollout. They're ahead of Texas, they're ahead of a lot of other places. But just in the last week, Texas has had a 53% increase in cases. And they've also increased in their positivity rate and their hospitalizations. It's because of the UK variant. Michigan and Florida are the two states with the greatest concentration of the UK variant right now. So that's where I'm talking about this race between the vaccine and the variants. That's what's going on there. So hopefully they'll be able to get
Ahead of that, and you don't see it continue to proliferate across the country. When we talk about long term,
here's the real challenge. It's global eradication. So I feel pretty confident about the United States and where we are and where we're headed and where I think we'll be over the next couple of months. You know, we've already said that we'll have vaccines available for every American by the end of May. I think that's great. We may even beat that. The greater concern is beyond America. So today, 75% of the vaccines that have been distributed across the globe, have been consolidated to 10 countries. So that means most of the globe is very, very, very early in their vaccination, or they haven't even started yet. So we may get herd immunity here, which would be fantastic, and we'll be able to return to some semblance of normalcy. But as long as it continues to proliferate other places,
we're going to have a problem. The mutations occur when it's transmitted from person to person. And the more it continues to transmit,
the more mutations we're going to have, and the more likelihood we'll have that there'll be mutations that can evade the vaccines we have in place today. So once we get through our herd immunity here, we really have to make sure, just as a nation, we're focusing on those other countries that have not gotten off to the great start and don't have the resources to be able to do that. So that's where I think some of the providers like Johnson & Johnson can make a huge difference, where, again, they don't have that ultra-cold storage, and some of the other ones coming up on the cusp don't have that as well. So that's the longer-term challenge. Okay, so I know it's dangerous to ever talk about politics and religion. I thought politics was probably easier than religion. If I do this correctly, this is a nonpartisan message, and if I do it correctly, I will offend every person in this room equally. So bear with me. Politics very much influences how we view COVID. I think we all feel that way, but there was a recent study that actually validated some of that. So it influences the way we feel about masks, it influences the way we feel about social distancing, about vaccinations, about having schools open or closed. This study from Franklin Templeton Group had a key finding. The whole study boiled down to this. The key finding is that Republicans consistently underestimate the risks of COVID. And Democrats consistently overestimate the risks of COVID. And the data they had demonstrates that. So I know these numbers are hard to see, but if you look over on the left-hand side, bottom left, that is a graph that shows, the question was, is it true that the flu is more deadly than coronavirus? And the Democrats are on the left, the Republicans are on the right.
about 4+% of Republicans said, yes, it is true, flu is more deadly than coronavirus. And it was about 13% of Democrats.
The second question was, do you believe, is it true that more people die in automobile accidents than from COVID? And Democrats, again, about 40% said yes. I'm sorry, Republicans, about 40% said yes. On the left-hand side, Democrats, around 17%. The third question was, do you believe, is it true that COVID-19 cannot be spread by asymptomatic patients? And about 38% of Republicans said, yes, that's true. And a smaller percentage, 20-some-odd percent of Democrats said that's true. Well, the answer to all three of those questions, in case you didn't know and you're a Republican, is no. All of those are false. But you see just politically a huge difference in the way that it's viewed. So The Republicans, in this case, significantly underestimated the risk. Now let's be fair. Let's look at this one over here. On the right-hand side, the question was, what is the likelihood you have to be hospitalized if you were infected? So if you look at the three graphs on the left, the Republicans are in orange, the Democrats are in red, or I'm sorry, in blue. The three on the left, you'll see that the Republicans had much lower percentages. They said 0%, much higher percentages of the lower rate of hospitalization. So most of the Republicans were right here. They said between 1 and 5%, and that's actually the correct answer. If you look over on the right-hand side, the Democrats significantly overestimated the risks of being hospitalized from COVID-19. About 2/3 of them said 20% or more of the people would need to be hospitalized. It's actually closer to 1%. So huge, huge difference. Now, the reason why I mentioned this, first, is I thought it was fascinating. Second, it drives how we view the world and how we view COVID. We view it through our own political lens. There's another part of the study that talked about the risk of children's mortality or hospitalization, and not surprisingly, Democrats significantly overestimated that. And not surprisingly, Democrats largely are more concerned about having schools closed than Republicans are. On the other side, this data would indicate the Republicans are less concerned about the variant. They've underestimated the risks and may not feel like a vaccine is necessary. Well, guess what? 83% of Democrats say that they have or will get a vaccine, and only 56% of Republicans say that. So I thought it was really interesting information. Another piece to this is they learned that as they gave the subjects of the study more information, it actually changed their perception. So there's hope for all of us. As we learn more information, we can get smarter and make better decisions. So I just wanted to share that because I thought it was really interesting. Okay, some healthcare concerns post-COVID. Staff resiliency, number 1 for hospitals. Number 2, hospital financial challenges. And the third one's are residual health implications. And all of these impact you as well and how you're going to receive your health care. So Jason, I know you can probably appreciate this, but the amount of stress that people that work in hospitals have been under, particularly direct caregivers, is unbelievable. And in many cases, unbearable. Hospital executives in a recent survey said 83% of them indicated they have nursing shortages, 30% of physician shortages, and it's due to burnout in the industry. These are people who have given their all for a year. They have lived on the front lines of this. They've come into work every day when everyone else was supposed to stay at home. They have dealt with uncertainty, and it's taken a toll. I was running on some of our ICU nurses literally last night. We were still talking about, I don't know if it's truly PTSD clinically, but their PTSD from the experiences that they've had. So another survey indicated that 48% of medical professionals in the last year have considered retiring, quitting, or changing careers. That's very concerning. About the same percentage of them have indicated that their mental health has deteriorated during that time. These are the people that we're counting on to be there to care for us in the future. So a lot of concern around the mental health of the staff and their well-being. If you look down here on this side, this is from a recent survey, or from a survey earlier this year. It said that 93% of healthcare workers indicated they experienced stress, 86% anxiety, 77% frustration, 76% exhaustion. Now, I want to mention to you, the time period of that study was June to September. Remember when I told you the peak was? It was in January. I guarantee if you did that in January, those numbers would be far worse. So a lot of concern about the resiliency of the people that we count on to care for us. There are also some economic considerations. 72% of physicians surveyed during this time indicated that they had seen a significant impact on their own personal income during COVID and the stress that can induce as well. So a lot of stress factors here, and burnout is a real concern for us. The second one is hospital financial challenges. And I'm going to overstate this, but I'm going to say that the hospitals and health systems that were in good financial shape, I think were fine. The hospitals that weren't, I think probably are even in worse shape. So there's been a devastating impact on hospitals from COVID. And so this may not make sense to everybody because you're thinking, well, a lot of sick people come to the hospital, that should be a good thing for the hospital.
Well, if you look at this graph right here, what this shows is the volumes of patients over the pandemic going through a projection to the end of June this year. So what happened is you had a huge spike in patient population, particularly back early in the pandemic.
And those were inpatient surgeries and outpatient surgeries, which, by the way, are where hospitals typically make most of their money. Inpatient admissions and outpatient visits. If you follow this line, right here at 100%, you'll see it's not until June this year that most of those hospitals actually get back to 100% of their volumes. And if you see the gray one that lags a little bit more than the other, that's inpatient surgeries, and that's where most hospitals make most of their money. This has had a particularly profound impact in rural hospitals. Rural hospitals are difficult hospitals to run. They typically have a very thin margin. This year, in 2020, 20 rural hospitals closed across the country. That's a record. That's the most in any one year. And in Texas in particular, if you look back the last decade, we have had 21 rural hospitals close, and that's the most of any state in the nation. So real concern about the viability of some of those folks that are there for their community today, and we need to make sure that they'll be available for their community in the future. So there's a lot of information on here. This is a Chamber of Commerce business. We have businessmen and women in here. This is all you need to look at. If you look at the far left-hand side, those two bars, both of those are revenue. So you see one of them flat and one of them decrease. The third bar is expenses. You see a 14% increase. The last two bars are your operating margin. So this is a median number year over year from 2019 to 2020 for hospitals in this country. And so even with the CARES Act, which provided funding to the hospital, the median hospital in this country had a negative operating margin of 1.2% with the CARE funding and almost 5% without the CARE funding. For all the businessmen and women in here, can you run your business very long without your operating margin? Right, so some real challenges there. And a lot of the pressures that they dealt with, that we all dealt with, are still going to be there in the future. All of our expenses have gone through the roof. It's incredibly expensive to staff a hospital right now, from all the burnout things that we've talked about, plus as communities have been desperate for caregivers, the rates have gone through the roof as we're all competing for the same limited number of people. So those challenges we expect to continue. The next one are residual health implications. And I'll let Dr. Kellum, the physician, speak to this later, but I do have a little bit of information about it. So I think about it in three different categories. The first one deals with delayed care, and we'll talk about that in just a moment. The second one are the lingering impacts of the COVID virus, and the third one are long-term mental health impacts. So this diagram right here shows you, this is a diagram of preventative care. So this is what people are doing in advance to make sure they're taking care of themselves and maintaining. These are vaccines,
Colonoscopies, mammograms, and pap smears is what's measured. So if you look back pre-pandemic, that baseline at 0% is kind of where you would expect. You saw a huge drop, and then even over the course of the rest of this year, other than pap smears, all the rest of those are still below where they would have been pre-pandemic. What that indicates is there are likely a lot of people who have diagnoses that haven't been made yet. And many of them have delayed care to where they're going to go in, they're going to see their physician, come to the emergency department, and they will be in a far more acute state than they would have been had they received this preventative care up front. So we are expecting that we are going to continue to see this. This is what we feel like we see in our emergency department today. We feel like our acuity level is much higher than it used to be, and we think we'll continue to see that. So those lingering impacts of delayed care is the first one. The second one on the left-hand side, you've heard about long haulers from COVID. And so those are patients. I visited with one yesterday who was incredibly sick in my hospital. He came back to visit us, incredibly grateful for the care he received. But he today, months later, still has significant healthcare issues that he's going to have to deal with for some time. The ones you hear the most about are hearts with myocardial inflammation, and you also hear about the lungs. You know, obviously this is a respiratory illness, so a lot of lung scarring and continuing issues related to that. So we don't know yet what the implications of this will be far into the future, but we expect a lot of these patients who have recovered are going to continue to have those issues. Kidneys with acute kidney injury and the nervous system are also areas that have been identified where we're going to continue to see latent issues. And then on the right-hand side, again, the mental health. So this physical health one, social isolation has been linked to a 29% increase in the risk of heart disease and 32% risk of increased stroke. That's pretty significant. And you look down at the bottom, this is probably not a big surprise. I already mentioned this about the healthcare workers, but it's for everybody. We have all been negatively impacted in terms of our behavioral health from COVID, and we are likely to continue to see implications of that for some time.
Okay, let's talk about some emerging business trends, and I'll do this pretty quickly so we can turn it over to the panel. The first one, so supply chain, virtual care, digital acceleration, artificial intelligence, and clinical advancement were a few I want to touch on. So supply chain, this is the one you heard the most about at the beginning of the pandemic, right? Everybody remember all the conversation about PPE, personal protective equipment? That's what we need to take care of ourselves in the hospital while we're delivering care, and we are having a tough time getting our hands on it. Does anybody here know where most of the PPE in the entire globe is made? China, right? 90%, for example, 90% of face masks are manufactured in China. So not only did the virus originate there, so their resources were being utilized there, they called back stock from other places from there, but then they also shut down a lot of the factories that build it for everybody else. So this exposed some really deep vulnerabilities in healthcare and really a lot of places about our supply chains. So some things I know we'll be seeing differently. In PPE, pharmaceuticals, and some of our equipment, we have to think about it in a different way. The government is going to be rolling out some incentive plans to incentivize domestic production. I think it's going to be some great opportunities for business leaders. I know with public contracts like the VA, they'll have requirements where they have to buy a certain percentage from domestic producers to make sure those can be viable entities. But we have to be able to be smarter about our supply chain. We have to be thoughtful about where we're getting it. Rather than, historically, you want to sole source because you get the very best deal. And when you sole source, if that source doesn't have it, you're out begging everybody else. So we'll rethink that. A lot of us operate with the just-in-time inventory mentality, right? We want to minimize our inventory. We have to rethink that as well. We've got to think about storehouses and how we go about making sure we're prepared for anything. The next one's virtual care. I know you're going to talk about this in a little bit, but virtual care, when you think of telehealth, telemedicine, very little of that really was done pre-COVID. So for example, for Medicare beneficiaries in February, less than 1% of all visits were done via telehealth. In April, that was already up to 43%. So significant impact. Just like you figured out you can have most of your meetings via Zoom instead of driving all over town, a lot of people and doctors have figured out I can do a lot of this work via telehealth. So I think we're going to see a lot more of that. This little graph down here on the right-hand side shows you, there's a study done in 2017, and they asked for how long of a delay would it take for you to get an appointment for you to do it via telehealth. And so if it was only one day delay, 34% of people said, okay, I would consider telehealth. It took until you got up to a month delay for it to get up to 59%. Survey today, in today's world, exactly 1 day. If you can't get me to me in 1 day, I'll do telehealth. So significant changes in the way we view that. This is pretty busy, but it just gives you an idea of how quickly telehealth took off in healthcare. So again, that's pre-pandemic with very low numbers. You see it spike up to about 61% at the peak. Some specialties are built for telehealth and some are not. So for example, at the very, very bottom, you see the red one. Well, that's orthopedics. If you have a broken bone, telehealth probably isn't going to help you very much. But if you look at the top one, that's psychiatry. We can probably do a lot via psychiatry. That's also an area where we have a physician and staff shortage, so we can benefit from some efficiency. So we'll talk more about that with the panel, but I think we'll see a lot of continued adoption of that. Digital acceleration. So there is a tremendous amount of information out there about every single one of us, about our health status. And we found during the pandemic, people are very willing to share that and use that information however is needed. So that's an opportunity for us to do things differently. This graph on the right-hand side, it just shows you the level of investment in digital health over the years. So if you look at 2019 right here, and then you look at 2020, it almost doubled in terms of dollars invested into digital health from about 7.4 billion to 14 billion. And then the straight line is, the line graph shows you the number of deals associated with that. So these are coming in all kinds of different places. Some of the big ones are digital health, digital therapeutic, particularly for people who have chronic conditions, so continue to monitor you, remote diagnostics and triage. If you're wearing an Apple Watch like I am right now, you're actually participating in this today. And home-based acute and primary care, so different things that can be done in different settings. So a lot of investment in digital health, and we'll see the fruits of those over the next few years. Artificial intelligence. So I don't know about you, but when I think of artificial intelligence, frankly, it scares me because I think of my childhood and I think of the Terminator movies. Okay, we're already using artificial intelligence today in a lot of different places, and this is really just further the utilization of that. So we're using it in clinical and non-clinical settings. Health management, so how we manage the population of a health, how it helps us in analyzation and predictive solutions for patients. In supply chain, I talked about how we have to be more efficient. Artificial intelligence is going to help us do that. It's going to help us be better predictors of what we need, where we need to get it, where it's available, and where those resources are available. And even things like the insurance industry. I know we'll have probably some discussion about that later today, but how we're really getting past some of the actuarial tables that we used before, and how we're really using AI to help predict the health of the population and help predict what that utilization of that population should look like. And the last one I'm going to mention is clinical advancement. So as horrible as COVID has been, what we usually find from crisis is innovation. We've seen it in world wars. We've had all kinds of innovations come out of world wars. And I think COVID is going to be very similar to that. And we're going to see a lot of things come out of research that's been done
during COVID that may have implications far outside of COVID. So I think we'll see more and more of those things coming out over the next few years.
One specific thing to COVID is the messenger RNA vaccines that we've used, right? That's Moderna and Pfizer. That was identified more than 20 years ago, but it was never put into practice until we needed it now. And now that it's been used and it's been proven, I think there'll be a lot more implications for that. There are trials right now for HIV and sickle cell anemia, and it'll be interesting to see what kind of inroads they can make in areas that we have not been able to make inroads in before due to that process. Genomics and gene editing, this is altering DNA. I know that sounds scary to a lot of people. I'm one of those people, but there are some really amazing things that we can do with gene editing and how you can identify the precision with which you can now go into DNA and identify specific components and edit it to improve a patient's health status. And we're going to continue to see that grow pretty dramatically over the next several years. And that kind of leads to precision medicine. And we see a lot of this in oncology today, where we're creating specific cocktails, chemo cocktails for patients based on them, based on their strain of cancer, based on their markers, based on their own genetics, that will be more useful for that individual patient than it would be for anybody else. And we'll see a lot of really tailored
Education like that over the next few years that I think will be furthered by what we've seen here through our pandemic experience.
So that's a lot about the state of medicine. I hope that all of that wasn't old information for you. I hope you're able to take something a little bit new and different. And I'm happy to visit with anybody when we have our break, if you have any questions or anything else you want to talk about. Thank you very much.
Thank you so much, Michael. Keyword break. As you enjoy refreshments and snacks, don't forget to meet Harlan Pickett, who has sponsored the snacks, and Sandra Crady. Where is Sandra Crady? Here, who has sponsored the drinks. And let's meet again at 2:41. Enjoy your break.
This live stream is brought to you by SureMed Emergency Medical Service, the highest rated and most innovative ambulance transportation service in San Antonio and the Tri-County areas. This live stream is brought to you by SureMed Emergency Medical Service, the highest rated and most innovative ambulance transportation service in San Antonio and the Tri-County areas.
Okay, we are about to experience a very fine group of people in a panel discussion that I believe will educate and edify all of us. I want to address a little bit who the panelists are. Dr. Daniel Callum, thank you so much for helping us today. I heard about Callum
When you have no insurance, you can't pay a doctor, for whatever reason, maybe you don't want to, or you can't have. There is a solution that Callum Family Medicine has for you. If you were to go to callumconnectmd.com or easyconnectmd.com, you can go there, and no matter where you are in the state of Texas, you got a consultation for $39.95, I believe.
If you want to have more information for that program in the Eventee app under More,
You can find that documentation. Callum Family Medicine is also very heavily involved in making our community safe. They have organized a lot of vaccination clinics,
and they are currently also contributing to making this region even stronger in terms of healthcare with the Schertz Medical Center. They are represented in Westover Hills and Alamo Heights. If you want more information about Insurance Medical Center, please speak to Gabe. Harlan Pickett is the second panelist, and he's an insurance broker that, in my humble opinion, is rare to find because he can truly to find healthcare on the marketplace or in the free market, whether you want to use traditional solutions or a little bit more alternative approaches such as free market solutions. Harlan Pickett is knowledgeable in all of these aspects. Matter of fact, he is so knowledgeable in the field of health insurance that he has helped the Federal Employee Services Association to come up with a custom insurance plan tailored for postal workers in the entire nation. And it is absolutely interesting to talk to Harlan, and I'm very curious to hear what he has to contribute to the conversation today. If you want to listen to Harlan Pickett, he's also the host of the Health, Wealth, and Power Hour, which airs on KSEV radio station out of Houston, which can also be found online. Dr. David Vequist, where is he? There. It's very interesting how he found his way to this event. Actually, in Facebook, we have an event, and he made a comment. If you're looking for a very handsome and world-renowned speaker to help you guys, let me know. So I went and looked him up, and not only is he handsome, but he's also very, very credentialed to be here today. Why? He is the founder and director of the Center for Medical Tourism Research here in San Antonio. And in case you don't know, for certain medical procedures, there are people who right now like to go, for instance, to Mexico, because it's up to sometimes, I believe, 70% cheaper to get the very same help than here in the United States. So Dr. Vequist researches that. And I think that is certainly an element in the conversation that we need to have today. He's also the vice president of the Health Care Standards Institute, and he is a professor at UIW, University of the Infinite Work, at the HEB School of Business. Dr. Vequist was very, very willing to help to bring more people to this event. As I told you, within 3 days, he wrote a white paper that you have access to in your app. Also, he invited a lot of his students who showed up in person. Do we have some students of the university? Yeah, in that corner. Thank you for attending. The Chamber hopes to build a relationship with your university and with students and to adopt the Center for Medical Tourism and Research. Thank you so much for your willingness to help and to respond to me. The next panelist, Dr. Roger Mochigamba, is someone who I met years ago when I just came to San Antonio when I was looking for a solution for myself. He spoke about something that is called direct primary care, DPC, and the idea is that you have a membership with your doctor, a direct contracting membership between an individual and the doctor. Back then you paid $59 a month, and then each time you needed to see him, it's only $10. And for me, back then as a freelancer, that was
very, very helpful. His model has since evolved. He is now able to help companies of any size find healthcare solutions that are based around the DPC model. As a matter of fact, in the app again, you will find a case study that outlines how his model has helped fairly nicely sized companies in San Antonio save thousands and I believe even $1 million figure in terms of cost during the pandemic. You will also be interested to know that he was very essential in the early days of, he was kind of pioneer in telemedicine. He was the founding president of the Teladoc Physicians Association. I believe Teladoc is a name that anyone knows. He has a master's in healthcare administration, and he also is the co-leader of the San Antonio Free Market Medical Association with myself. These people that I just introduced to you will be able to give many different perspectives on a topic that is not always easy to discuss, but that is very interesting to discuss because healthcare, as you know, is important for all of us as individuals and as business owners and as elected officials and as city officials. We all care about that topic. I would like to really thank Gabe Farias for being available to moderate this conversation. It is really not easy, in my opinion, to do that because you have to have this vast understanding to guide us through this conversation. And really, the chamber board told me there is no other than Gabe Farias, and luckily he was willing to do that for us. So thank you so much, Gabe. And now is your moment to shine.
Boy, do I have him fooled. Oh my goodness. First of all, Shankar, thank you so very much for putting this together. Shankar has been a vital piece of the Tri-County Chamber family for years. And when he was selected as the individual to take my spot as the chairman of the board, I couldn't think of a better individual than to take a concept, an idea that we had discussed a couple of years ago when we were kind of planning what turned out to be the COVID year for really the entire world, was a state of medicine event. What ended up happening out of that, because of last year's the pandemic, we ended up having a really nice event with Dr. Kellum and Michael Beaver where they did this side-by-side teleconference type of thing. It was a good success. But Shankar, to say that you've taken this to the next level is an understatement. Big round of applause for Shankar for what he's done. And kudos to you with your bride to be in the front row of the Match.com joke, man. That's guts right there, man. There you go. So that's a very Gabe-esque joke. He said you're the one that told him the joke, did you not? No, that's a hard no. You're in trouble, buddy. I would never do that with Katie in the crowd. I want to introduce a little bit about myself. I'm the former chairman of the Texas Tri-County Chamber of Commerce, which, by the way, we haven't said her name, Minnie Paxson. Give her a big round of applause. She's our leader, our CEO for the chamber. She does a fantastic job every year of putting up with guys like Shankar and myself. So, Mindy, thank you so very much for everything that you do for this area. I'm going to go ahead and introduce the panel right quick if I can, because we have got a wonderful panel, and I want to go ahead and get started. Before I do that, though, Michael Beaver from Northeast Methodist, thank you so very much for that wonderful speech. You took the edge off of everybody exactly with what you did. Lots of great and fantastic information. So I'm going to go and start calling the panelists up to the table. Dr. Roger Machigamba, MD from Direct Med Clinic. I feel like I'm announcing in a basketball game. And starting at power forward. Actually, this guy will be the power forward. Harlan Pickett from Harlan Pickett Insurance. He's a broker and a great friend of the chamber, and he's going to offer a fantastic perspective to what we're talking about. Shankar, you told me I was the best looking one here, but you said David Vanquist. Dr. Vanquist is better looking. Dr. Vanquist, come on up here, man. He's the founder director of the Center for Medical Tourism at UIW. And last but not least, Dr. Daniel H. Kellum, CEO of Kellum Physician Partners, which includes Kellum Wellness, Kellum Family Medicine, and now Kellum Real Estate. Quick plug, if you're driving down 3009, and if you're going away from 35, look to your right, that big area is the start of the Schertz Medical Center, which is going to eventually house about 70 to 80,000 square foot worth of medical office space. And the reason he's doing this is he wants for people of the Texas Tri-County area to not have to go and see a cardiologist in downtown, or not have to go and see any type of specialist. We want to bring medical services to Tri-County area. So Dr. Kellum, thank you so very much for everything you're doing from a community medicine standpoint. So right off the bat, first question, Dr. Vanquist, when can I travel to Cabo? Like, when is that going to happen? Oh, not that kind of tourism, right? No. You know, guys, we're going to start with COVID. Obviously, that is, it's kind of hard to vary off of that topic. And one of the outstanding, and we've talked about it all day, has been not the establishment, because we've got two individuals here, Dr. Machigamba and Dr. Kellum, who have been instrumental in really moving telemedicine to the forefront. But Dr. Kellum, I'm going to start with you. Talk about the importance that telemedicine has played here as we fight this pandemic and as we keep patients safe.
Well, it's played a huge role. Initially, when all of this started, there was a lot of apprehension from coming into offices. So there was an ability to keep in touch with patients, to go over some more pressing needs and allow that relationship to continue. As this whole phenomenon is continuing, there's a ton of apprehension. People coming to the office, speaking some to the place where we were talking about in terms of lagging the footprint there. So for us, it's been a ability to stay in contact, manage some of these things to the best of our ability, continue to work through things this vaccine.
And this is one of those things where you had, he talked about Kellum Connect MD, which was the initial product that we had. It's moved from Kellum Connect MD to Easy Connect MD, and because of that, because of your establishment, you really hit the ground running when it came to telemedicine here in the state of Texas.
We did actually. So when they first changed the law to allow us to accept new patients into that, that's when we started our program. And our whole idea was to be able to get out to people who didn't have insurance, who had a hard time reaching doctors, to be able to do it in a way that was affordable and effective. And we found telemedicine to be that tool. It had worked with all of this going on into the ability to help people during this pandemic. A lot of fear, questions, a lot of different things we were able to address in a very simple, easy face-to-face visit. Our whole mission with that is to be able to reach as many people, to provide as much care at a low cost as we can. And I think that's ultimately what Easy Connect will evolve back to. But for us, it's been a wonderful tool to be able to continue to facilitate care.
Dr. Machigamba, looking at your resume, you have just an extensive grasp of the telemedicine world. But one of the things we talked about in the lobby was telemedicine versus virtual care. Can you kind of talk a little bit about what your definition of telemedicine versus virtual care is?
Y'all hear me okay?
You have to use the hand mic. Those are just for the live stream.
Okay, so I've been doing telemedicine for since 2004. So very familiar with that. I'm one of the physicians founders and pioneers of that. And so in that model, telemedicine is you get to connect with the doctor on the phone or through video. It's not your treating doctor. So over those initial years, that was new, and that rate as a physician, as a trained physician, we know how to take care of people. So we know our boundaries there, what safe is not. So now virtual care is what I've been saying is the next evolution of telemedicine, where it's not just a one-time talk to the doctor on the phone, but virtual care is like if you don't get better after this, I'm still here for you. Or now that we've kind of broken the barrier the last year with bringing telemedicine on everybody's radar, and people are a lot familiar with it. We in virtual care, we as treating doctors, primary care doctors, are more going to be able to, with our patients, order labs, treat them at a distance, follow up on the lab, help them bone or sprain, or even send them remotely X-ray, get results back. We can visualize laceration while we're at the film and say, I think that's going to be okay, please or no, you might have urgent care, or come on to clinic and get stitches. So we can actually do a lot through virtual care and have people come in the office. We as trained physicians, we know what boundaries are when people need to come in and when we can handle virtual.
And that's a big thing in telemedicine is trust. And you know, the confidence, and those are all things that good trained providers, whether they're PAs, nurse practitioners, or MDs or DOs, they do a good job. Confidence is everything when it comes to assessing and addressing telemedicine.
Folks are comfortable with their primary care doctor. Yeah. And so virtual care, telemedicine, it's just a tool.
Absolutely. Harlan quit. Telemedicine obviously from the business community, from insurance. Talking about how telemedicine is changing, going out and selling policies.
Absolutely. There is no doubt it has become a bigger issue over the last year. When talking about primary care physicians, I think it's very important to point out that in 2020 we lost about 8% of our primary care physicians across the country. Over 16,000 primary care physicians left their practices, joined with other groups, or else just got out of business completely. Some of those numbers were shown in graphic we put out there. But a lot of those were not able to adjust or adapt, as Dr. Jumbo has, and Dr. Calvin has, to a virtual and also a telemedicine way of taking care of their people. To directly answer the question, I don't have anyone I talk to now that doesn't ask, what's the telemedicine part of this? What's the virtual care part of this? And you're seeing a bigger change in insurance companies addressing that also, Gabe. Because what you see now is many of those guys, while they had it hidden somewhere, there was many times a higher copay for telemedicine or virtual medicine than there was to come see the doctor. How much sense does that make? But pretty much all of them have now come around and understand that you have to offer this service just so you can have a true, all-encompassing, holistic care for your patients now. And that's very big, because really you have companies and individuals that absolutely must have telemedicine in their plan now.
Dr. Vagos, I know that you talk about, you specialize in medical tourism, and you know, if I want to go down and get a nose job in Jalisco, Mexico, I'm guessing that's what you specialize in. Do I need a nose job? Or y'all like looking like, yes, you definitely need a nose job. Tell us telemedicine, besides, okay, turn to the left and see what your nose looks like, but does telemedicine play a part in what you do? And has it helped in the pre-visit, if you will, before somebody does a travel to go get some work done?
Yeah, so in medical tourism, it's not well known, but actually the most common form of help-seeking behaviors that people do across borders, whether that's outside of a city or a county or a state or even a nation, typically tends to be dental. So that's the most common form. There's also pharmaceutical tourism, there's tourism for fertility services, fertility, cosmetic, wellness visits. So it's not just the typical medical surgical that typically make the news. But the interesting question you asked was about telemedicine. It has been hand in glove in terms of medical tourism, because many years ago when an American would fly to India, for example, to get a cardiac procedure, for example, they would oftentimes talk with the physician or surgeon via Skype before they would travel. So it's been a very common element of medical tourism. And we've also seen the use of telemedicine to serve people that don't have access to care, particularly specific specialties or specific types of expertise that you need. And so medical tourism really is consumerism coming to healthcare, and that is telemedicine. That's finding your preferential way of being able to access your provider.
Okay. Dr. Matagamba, access to care during COVID. When this thing hit, we started hearing about it in January of 2020. Then February, people started getting really leery. And then March, I sent my kids off to school. When they came back for spring break, they didn't go back to school until this year's spring break. You talk about the shock of all shocks. But as it pertains to healthcare, you guys still needed to see patients. You guys still needed to treat issues. Michael brought up an interesting point, the COVID ripple, and I didn't really think about it until I saw his presentation. What do you do as a doctor to tell a patient it's safe to come into our clinic right now? Is it as easy as we clean the place up? All of our providers, all of our folks have been taught how to maximize making sure that offices are ready. What do you do to try and tell people it's safe to come back to the clinic?
Okay, good question. So we follow the guidelines obviously put out to the city, but by the city, but
I think also that part answer to that question is the trust that was mentioned earlier.
But then on another level, what we did specifically in our clinic is obviously all the sanitization and the checking the temps at the door. But we were in touch with all of our patients through our HIPAA compliant secure app. So we regularly and frequently sent them video messages or text messages letting them know what is going on, what the state of the clinic is, what the state of the environment is around with COVID. And we let them know that we're still there for them, but we just had to tweak operations a little bit to let them know if you have a respiratory complaint, reach out to us and we're going to do a virtual visit first. And then we'll have you do a drive-by test. And then if you need to come into the clinic, then you come in. If you're coming in without a respiratory complaint, it's just basically business as usual. We'll check your temp at the door, and that's kind of the way we've been handling that. And it's been a wonderful thing. We've not had, to the best of my knowledge, really COVID in our clinic, and our patients have been safe and they had access.
Dr. Kellum, how important is, two words, communication and trust with your patients? Because it seems like they go hand in hand. You go above and beyond in providing video podcasts to patients. Talk about the importance of communication as it pertains to letting folks know you can't come into the clinic as long as you take these protocols.
Well, I think that's very important for all the reasons that once again just talked about. For us, what it allowed us to do was hopefully to express to our patients that we had an understanding of the disease. We had an understanding of the protocols. We were implementing the protocols on a regular basis. And I think that gave people the underlying trust that we had already built up for years, accentuated that to a degree, and made them feel comfortable coming in. We're also very diligent as we're about screening, questionnaires, those types of things to make sure we were protecting ourselves, protecting other patients. But the most important thing is, which is people again, is just reaching out to patients to let them know what the criteria, what our barriers are, what our procedures are. And people were very comfortable with that. And it was initially slow at the beginning, but I think people after a while got comfortable with things and started coming back to them.
Is it safe to go to Kellum Family Medicine?
Absolutely safe to go to Kellum Family Medicine.
All right, there you go. Dr. Matsuyama, I'm guessing it's safe to go back to your clinic as well, right? Absolutely. Dr. Vinquist, you're not, people see Dr. Vinquist and they automatically think, hey man, can you check that mole in the back of my neck right quick? And, you know, that's not the kind of doctor. Like, as you're staring at the mole, you're like, I'm not that kind of doctor. But you're obviously somebody who's in the community, people trust from a community member standpoint, not necessarily from, because you kind of touched on both medicine and community. What do you tell folks that come up to you, man, do I go to a clinic? What do I do? What's your message to them?
Yeah, so one of the things that we find consistently is that people are using the internet for searching for information about healthcare. A couple of academic studies, actually been 2 or 3, that looked at the amount and quality of information that's available on the internet about healthcare, and it's not good news. So it's overall about 66% of the information on the internet is either incorrect or out of date when it comes to healthcare information. And so, and obviously we saw an amazing growth of amateur epidemiologists over the last year, as well as a couple other specialties around viral infections and everything else. So it's buyer beware is the case in almost every other industry, and it is in healthcare as well. So the internet, however, has played an important role in healthcare and will continue to. It's actually the majority of the reason for the modern emergence of what we call medical tourism today. And so there's some really interesting research out of Pew, and we can go over that very quickly. And I'm sorry, make it interactive with everybody. So you guys got to promise, okay? So you got to promise to keep your minds out of the gutter, okay? All right, so what's the most common usage of the internet in the United States?
ESPN, yes. And if my wife is here, it's ESPN, I promise.
WebMD.
Not even close.
Anybody? Sorry, WebMD? No, not even close. Number one use of the internet, it's the killer app of the internet, it's email. That's how most Americans use the use the internet for. Number two use of the internet, and then most frequent use of the internet.
Can we skip that one? By any, just because.
Keep your minds out of the gutter. What did I say? Come on, guys.
Google? Search?
My gosh, all of you are over the age of 35, aren't you?
Social media.
Students, can you tell them what the second most common use of the internet is? Social media, that's right. And so, okay, and in the United States, the third most common use of the internet? Healthcare. Turns out it's ubiquitous to the human condition, and it turns out that it's one of those things you don't have extensive knowledge about typically as a layperson. So therefore, if you hear that your mom has a lump, one of the first things you're going to do is help me out. Yeah. And it turns out that people that use mobile devices are actually even more likely to do that. And this is all verified by research by Pew, did a really large sample study on this. So the internet and healthcare go hand in hand in both good and bad ways, and again, buyer beware. We just accept that when we're buying cars or if we're going out to a restaurant. We just don't realize that we have to be wary of the advice that we get on the internet when it comes to healthcare. Does that help?
Yes, it helps that my mind is in the gutter, that's for sure. Harlan, you and I talked about this earlier. Our insurance guy is one of my most trusted guys. I trust him quite a bit. I'm sure you get that same question. Harlan, why should I go into a clinic? Is it safe to go into a clinic? And again, this is coming from somebody who sold a policy to somebody.
Right, absolutely. It's very interesting what Dr. Vinquist was just talking about, because most of those people don't actually get on the internet to look for that. They call me. And they ask me, what? I got that mole in the back. What do you think I should do? Go to the doctor, man. What do you call me for? I'm the insurance guy. I don't know. But it is interesting because I do get that call. You're right, it is about trust. I've talked to them, I've walked them through, they've told me very personal things about themselves to make sure that we match the right plan to them. And now they think for some reason I'm also a doctor. And they're calling me up and they're asking me these questions. And I'm like, you need to go see Dr. Keller. Where'd you go? I don't know, man. But it is. It's very interesting And I think people are very much getting back in the frame of mind that it is safe. That it is safe to go. I have clients that are now going and getting those things done that they've been putting off. That knee replacement that has really been bothering them all this time, but they were just afraid to go to the hospital. They were afraid to get some of these things done. They live with the pain because they were afraid of the repercussions. They were afraid to go to the hospital and get sick, go to the doctor's office and get sick. We're seeing a turnaround now. We're seeing a turnaround where people are tired of being afraid. They really are. They're tired of being afraid, but they also see the advancements of what's going on as we fight this terrible pandemic, and they have more trust in the doctors and the facility that they're taking care of those places and keeping them clean.
You know, and that's a great lead into the next topic, which is vaccines right now. And you know, at least here in the United States, we've got 3 different vaccines: the Johnson & Johnson vaccine, which is the one shot, the Moderna and the Pfizer vaccine. Dr. Kellum, you immediately, as soon as this came out, you were one of the first in this area to say, "Give me more. We need to vaccinate people, not only in this community but throughout the state of Texas." And you've done that with vaccination clinics in Crystal City and Medina County, and you know, the one that you at the Bluebonnet Palace the other day, where we vaccinated over 750 Tri-County area residents. 30% of this country right now says, "I don't trust it. I don't. You know what? I don't want to do it." Convince. Let's say I'm one of those 30% of the individuals. Convince me why I need the COVID vaccine.
You know, that's a difficult question, only because everybody has different reasons why that is. And some of it's personal, some of it's conspiratorial, some of it is exactly set out to get it. Some of them think that we have medical conditions, and so to convince to that, you know, you need to speak to the individual issue.
Yeah.
But I think it's definitely the thing that I see across the board is that if they're in there and they trust you, and you share with them that you've gotten it, your people have gotten it, your family has gotten it, it's really been something that people are willing to learn to, and I think it's been very helpful. And so we're starting to, well, the vaccination clinics in themselves, the numbers that we're drawing, there's a ton of people who really do want to get the vaccine and get this behind them. But then those few people that are still having difficulty speaking to that percentage, you know, I think it's just going to be a matter of time, getting face to face with them and letting them see that everything's going to be okay.
So I wasn't supposed to use the P word.
Michael, since he used it in a presentation before, I'm going to go ahead and use it because in this sense, how do you, in an exam room, Dr. Montagama, you're next on this one, in an exam room, because I'm sure you've heard this, how do you take politics out of a medical conversation when you're trying to tell someone, you know, this is what you need to do? It's almost impossible to be void of politics in something as sacred as an exam room. How do you do that? How do you tell folks this is where you've got to draw the line?
So that's a great question, and I'm glad you asked me that because I feel like the whole pandemic has been way over politicized, and part of the reason for that is that folks have sort of lost touch with their doctors. There are a lot of people that are scared out of the community, and they're confused because there's been so much talk about what the CDC is recommending, and then things change here and there. And it's confusing for a layperson to follow all that, and so they get scared, confused. So really, I feel like it goes back to the good old-fashioned doctor-patient relationship and trust. Okay, so the doctors know the science.
And so if you have questions, I feel like you really need to access to your doctor and talk to him about that and say, look,
your risk is really, really low because you don't have any of these risk factors. Or on the other hand, they're like, well, you have a lot of risk factors, so we need to do this, this, and this for you. Okay, so I think it comes down to that. It's trust in the good old-fashioned doctor-patient relationship.
And to that point, you know, you talked about the role of government, and to Dr. Vanquist's point, you know, the internet is something where people look to find and seek information. What do you think the role is of the government agencies, the CDC, the county health departments? the Department of the Texas Department of Health and Human Services. Where do those roles play in the holistic picture of medicine, at least as it pertains to COVID-19?
Right, that's a good question. And so the role of the CDC and our local health department is to take care of the public. That's
public health. And so they make recommendations, they follow numbers, and then they present those to doctors. They present those to the community, mostly doctors. So it seems like what it's kind of turned into are the CDC and NIH has kind of gotten in between the doctor and the patient. So I think that's left a lot of confusion, and so it really still goes back to doctor-patient relationship.
Harlan, I'm sure in what you do, you're selling insurance, you're talking about this stuff. How do you keep politics out of the conversation? Because at the end of the day, you want to sell policies and you want to continue to grow your business. It's almost an impossibility. How do you do it? Not necessarily from a medicine standpoint, but just as a small business. I'm sure you've got several folks out there that are trying to sell houses or trying to sell insurance or trying to do things just to improve their quality of life. How do you keep politics out of the conversation? It's hard, I guess.
It is. It's very difficult. But what I look at it in a very different and broad view. Whereas I sell insurance, I also offer a lot of non-insurance products and many, many products that I don't get any type of monetary benefit at all. Therefore, I can help any wide range of individuals.
Yeah.
It is really about helping people. And when people understand that you're just trying to find out where the pain is and that you're there to help them, there's not really any place for politics to come into that, right, Gabe?
Yeah.
Because we're not talking about that. We're talking about you. We're talking about what your situation is. And let's get you taken care of. Whether you're left or right in the middle, it doesn't make any difference. Let's take care of what your pain is.
Yeah, same thing with medicine. Dr. Banquist, I'm going to change subjects here because I read your white paper, and one of the headlines that just blew me away was, what is the upcoming millennial health apocalypse? What is that?
Yeah, so we're seeing a variety of changes in demographics over the years, and the physicians, particularly on this panel, can speak to this probably even more so than I can. And there's a lot of unfortunate trends around particularly chronic disease and social determinants of health, which tend to have upwards, if you include genetics, up to 70–80% of the total healthcare outcomes are not due to necessarily what a surgeon with a scalpel is doing, but all the things that led to that moment where you're in the operating room. So what we're seeing is, for example, rates of obesity among millennials. There's some estimates out there that say that 7 in 10 of millennials will be obese by the time they're in middle age, which will happen over the next, say, 5 to 10 years. For the vast majority, some of them are already approaching that age. Millennials will make up about 75% of the total workforce by 2025. We also have physician retirements and physicians, as Michael from Northeast Methodist talked about, physician deciding to get out of medicine. And with some of those numbers, we're seeing a lack of physicians, potentially hundreds of thousands in the United States by 2033. So altogether, we're ending up with a very difficult situation where we're going to have people that are requiring much more health care. American Cancer Society just announced that 6 cancers that are unfortunately growing are growing in people under the age of 50 more so than they are in people over the age of 50, mostly because of health conditions. And then we have a lot of mental health issues, some of which were before the pandemic. We're already seeing large rates of mental health issues, particularly among young people, and then the pandemic has definitely aggravated that and made it even worse. All these things look to make, unfortunately, healthcare a bullish industry in the future, but also fortunate for entrepreneurs that are looking for solutions to bring better quality healthcare at lower prices. But there's some evidence out there. I think a paper has suggested that the trillions of dollars we're already spending for healthcare in the United States will go up by 30% potentially in the next decade or so, just because of some of these conditions.
Dr. Kellum, the millennial health apocalypse, as it pertains to COVID, you got these 20, 21, 22-year-old, 23, 24, am I millennial? I'm not a millennial, am I? What am I, a Gen Xer? Is that what I am? Okay, this means I'm old. You got all these guys going out, they're going to parties, and they're going to weddings, and they're living carefree, all with this pandemic, all without the vaccine. How important of a decision was it for the state of Texas, which kudos to the state of Texas, opening it up starting on Monday? Anybody can get the COVID vaccine here in the state of Texas, especially as it pertains to what Dr. Banks was talking about with this millennial surge of this carefree attitude. It seems like now that they open it up for everyone, more vaccines will be given, and it will help reduce the problem. How important was it for the state of Texas to open that up?
I think it was very important, actually, because I think that people were waiting before they could get in line for vaccine based on their age and underlying disease. What we have found in the clinics we have gone out to is that there's often not enough people for the vaccines that are available in those rural communities and stuff. And so we've been practicing, you get in line, we give you the vaccine. Didn't matter to us at that point because we just wanted shots in arms. And I think that was the right approach, actually, because the more people we get at least one shot in, the more protection we get across the board. And my hope is that has somehow began to lead to this decrease in COVID cases, and hopefully will continue over time. But I think that as people feel like they're worthy of getting it, or at least it's their time to get it, I think that it's very, very important. Some people had the presumption it wouldn't be till May, June, July before they were able to get that. And I thought that was a really bad thing. And so now that it's open, I think it will certainly open up the floodgates for people to come in and get it.
Yeah. Dr. Machigamba, one of the things that Mike talked about was post-COVID burnout. And in the clinic, we've seen some of that. Folks are I think you said 47% of folks are thinking about retiring from what they're doing. How important is it right now to put an emphasis on training the future, not only doctors and nurses and PAs and nurse practitioners, but training the future MAs, training the future phlebotomists? How important is it to put an emphasis on education here in the state of Texas as it pertains to the medical industry?
Okay, so to guard against medical burnout, even down to the level of the MA, that's the question, right?
Yeah.
Okay, so I think that's a great question because that's definitely on the horizon. And I think it, first of all, is going to trickle down from up above, from the doctor level to the hospital level. So our staff, I think they have to see that we are competent and we know what we're doing. We know how to handle the disease. And this is something that we've been talking about almost weekly in our staff meetings. Like, look, this is what we've been trained to do. We know how to take care of infectious disease. We are going to follow these standards. We're not going to deviate from our basic training. And for the most part, that's what we've done, and we've been very successful with keeping our staff disease-free as much as possible. So I think that's what's going to have to come from.
Okay. All right, guys, we're going to take a quick 10-minute break. When we come back, the panelists are going to discuss issues like mental health. We're going to discuss, more on the COVID ripples. So take a break. We'll grab some snacks, grab a drink, and we'll be back in about 10 minutes. Thanks.
This live stream is brought to you by SureMed Emergency Medical Service, the highest rated and most innovative ambulance transportation service in San Antonio and the Tri-County areas.
Yes, appreciate you guys being here for this panel discussion on the Tri-County Chamber of Commerce State of Medicine. Our panelists, again, Dr. Roger Machigama, MD Harlan Pickett, Dr. David Venquist, the fourth. I didn't realize that, Doctor, you're the fourth. So there's 3 other David Venquists. I guess that's how the fourth works, right? Okay, there you go. And Dr. Daniel H. Killam, Jr. I've got to say that because he looks just like his dad, and his dad is, I guess you guys, what, 80? How old's your dad? I'm not saying you look 80, I'm just saying you look like your dad. That's all I'm saying. You gotta remember who signs my check. All right, there you go. Harlan, I'm going to start with you as we kick the second part off. Changes everywhere. Everyone keeps saying the new norm. What's the new norm for the insurance industry post-COVID?
What is the new norm for the insurance agency? Wow, that is a very interesting question.
Because I don't believe there is a thing more. I think that we are seeing across the board, not just in health insurance, but also in life insurance, long-term care,
All of the different places, a lot of
easiness. Because they don't know what the future is going to bring with COVID. They don't know how to treat it in the future. If you say you've had COVID, there's that question.
It's now starting to show up on applications. What does that mean? Does that mean that I can't get the insurance? Does that mean my rates will be higher? What is that going to mean to me in the future because of this pandemic? And that is bringing a lot of unease. We saw this year rates go up for health insurance again, even though we know for a fact that last year's usage went down. There's not a rhyme or reason to that. There are insurance companies that are more or less rolling the dice at this point saying, well, we got to raise the rates because we think there's going to be a bounce back. We think that people are going to go back to the doctor, so we have to be ready for that, and we'll go ahead and raise the rates on that. That's simply not fair.
It's not right, but it's what insurance companies do.
And I'm guessing it's all into underwriting, and it all depends on it, because when you hear underwriting, when an insurance agent tells me I was in underwriting right now, is that a subjective direction, or do they have a list of criteria that everybody has to follow, maybe through the, I just don't know enough about it, but you hear about, oh, it's in underwriting, hang tight.
It is in underwriting, and that question's also in underwriting.
Okay, there you go.
But what I mean by that is that it depends on the company. There is not a straight across the line, every insurance company, every health insurance company, everyone treats it all the same. Now, we all know that if you are on or off marketplace on an ACA compliant plan, it doesn't matter. You're going to get approved because there's no medical questions. But those plans out there now that are helping people get their rates down by doing underwriting, even on the in my opinion, the best deals out there, level and self-funded plans for groups, there is underwriting involved. So if you're a pretty healthy, younger group of employees, you can just beat the tar out of standard insurance rates. I just saved a construction company $75,000 this year by putting them on those type plans. And there's a lot of money to be saved, but people are right now in the mindset that we've gone without underwriting on health insurance for so long now they don't want to do it. They don't realize the benefits. You know, when I got in this business, when a lot of people got in health insurance, everything was underwritten. And we look at what has happened, even back then,
it wasn't always great, because if you had diabetes, you weren't getting health insurance.
And you look at that, and that is almost epidemic-wide now for something you guys see it all the time, see diabetes, and back then you couldn't get health insurance, period. You got some limited benefit plan that just didn't pay anything. And now you can get it, but the cost is so astronomically high that you would be much better off visiting with one of these guys and getting a membership at a clinic and having it take care of the chronic illness in a much better way than you would be getting a high-dollar insurance plan to take care of it.
Dr. Machigama, as it pertains to that, what's your philosophy on preventative versus reactive medicine? Obviously, we all know, the importance of preventative medicine.
I already know Dr. Caleb's answer, but I'm just curious to hear what your thoughts are on proactively treating patients.
That's what we're all about.
Yeah.
That's what our whole model is all about, and that's what we preach to employers is, look, we want to get our arms around your population health of your company. We want to touch everybody and let them know that we're your doctor, and we want to do screening on them for chronic disease or risk factors, and we want to treat them early, keep them from going to the hospital if they don't need to. So that's we're all about that.
Dr. Kellum, same question. I know the importance. Talk about the importance. Obviously, we have to do it as we deal with the Medicare population. How do you see that transitioning to a younger demographic where we have a list of measures, and you kind of have an unwritten one, but do you see that formalization of a younger demographic needing to meet certain measures, maybe to get insurance premiums down?
I think there will certainly be a move in that direction over time. I think it would be a little bit more difficult of a proposition, quite frankly, as younger, healthier people are less inclined to come to the doctor on a regular basis to be checked from a preventative standpoint. But ultimately, I think that cost savings will make its way from the Medicare population down to the general population.
I'm going to change the subject right now. And while you have the microphone, everyone has talked about extensively the physical ramifications of COVID-19 and what it's doing to your bodies. My daughter, I don't mind talking about this, you and I talked about this, she had some issues staying at home, not being around folks, and it just leads to the whole, the mental aspect, the behavioral aspect of the COVID ripple, if you will. Talk about the importance of doing whatever we can to get folks back to work, to get kids back in schools, and how big of an effect that them not being there has had on their mental and behavioral situations.
Well, I think it's certainly had a big effect, and I think that's a two-part question. I certainly think we all need to do our part. When this first started and spiking, the people that were really on the line were the people in the hospitals and nurses, taking care of the people that were sick, sometimes making decisions about who could get care, who couldn't get care. Nurses would be their caregivers, their family members. And it was a horrific situation. As we got a little bit of a break, that got a little bit better, but then that spike happened again, and those group of doctors and nurses, I think, were disproportionately hit with the burnout that we talk about with care. As vaccines rolled out from a preventative care standpoint, that's where we pick up the baton and we move forward, because if we're able to get vaccine out to people that historically may not have access to that, we can begin this whole prevention process and hopefully, take what our colleagues have done, honor people that have passed away, because I would bet every one of those people would say get a vaccine if they could tell us one more thing, and then really work on preventing things. The second part of that, though, is that I do think we're going to see, at least what I've seen in my practice, is a little bit of depression for sure. Certainly it's a little bit of a fallback in terms of overall control, hypertension, diabetes, whatever that may be. And really our push this year is to get people in to reestablish a baseline of care so that we can understand where they're at right now, and then take this and move forward and begin the process of getting back to normal, whatever that may be. But for sure, from a healthcare perspective, getting a sort of a reassessment of where people are at, because this year took its toll on people for sure. And I think we, as quite frankly, I believe strongly that medicine saved the day. And now I think it's our opportunity, our duty, quite frankly, to get people and have them understand the difficulties as they move forward. One of the things that we have seen is that people with poor health, obesity, diabetes, they were disproportionately affected with this. And so as preventative care doctors, it is important and incumbent on us to let them know that those were the issues that really were problematic, and really work hard to try to change that to a great degree.
Dr. Vakos, you're a college professor. You see millennials, you see people of all ages in your classes.
But I'm guessing for a while that stopped. You went from in-person to televisits, or to tele classes.
How do you deal with that? I know that, again, you're not an MD, you're a PhD, but I'm sure that you have the wherewithal to understand how to help people and lead them in the right direction. As a professor, how do you deal with the young kids that were going through, I'm sure, some difficult mental situations that they felt they could lean on you for?
So the great thing about history, about reading extensively, is you learn that things like this have occurred before. It's not well known that there's been a global pandemic approximately every 27 years of human history These things have happened often in the past. It's just that due to increasing standards, protocols, the maturation of healthcare and particularly science that goes into healthcare, and a variety of other factors. It's been 50 some years since we've had a truly a global pandemic according to WHO standards. So we've been through this before as humans, as society, as culture, as civilization. Our grandparents and great-grandparents could tell us wonderful stories about how they went through this and survived. What we found primarily, particularly in healthcare, was that a lot of the pandemic, the bad things were almost always about politics. It's funny how that was mentioned earlier.
Yeah.
The bad things were all about politics. All the good that came out of healthcare was primarily markets. What we've seen is, for example, we've seen this wonderful growth over the last few years of DPC practices. We've seen obviously an amazing growth due to government rollback of regulatory barriers in telemedicine, which I have to tell you has the potential to impact healthcare in rural communities where, as Michael pointed out, there's been substantial bankruptcies and closures of healthcare facilities. We've seen the self-insured market, which we just heard about, which has been a hidden revolution in healthcare that has continued even during the pandemic, with more and more companies becoming self-insured and directly contracting with great physicians, great hospitals, great centers of excellence. So all of this that has gone on has been primarily the market and free enterprises and entrepreneurs developing apps, insurance agents developing ways to reduce pharmaceutical costs. There's people in this room that are actually on the forefront, on the edge of making healthcare better. I know that doesn't completely answer the question. So the question was around young people, telling young people the story that the world is getting better. It's not well known, but if you look at the rate and incidence of death and disease around the world, particularly when it comes to healthcare today is monumentally better, and these gentlemen on the end can tell you monumentally better than it was in the 80s, and it's getting much better than it was in the 90s. We have standardized protocols and procedures. We've increased our efficiencies and efficacy of certain types of procedures and pharmaceutical regimens. It's getting better. So I think knowledge of history, and then letting them know that there are a lot of people at work doing some great things, and things are going to get better.
Harley, you and I talked before we started this discussion about how mental health is asked to you probably as much, if not more, than COVID. Talk about, from the insurance industry, how you see mental health being insured, being covered as we move forward after this year.
Yeah, absolutely, Gabe. It has become one of the biggest issues, if not the biggest issue, when individuals ask me, or even companies ask me about the coverage options that they have available. Having mental health for themselves as individuals or for their employees, because it is asked about all the time for employers, is what type of plan, what type of mental health options do we have in our plan? And historically, there's always been something, but it hasn't, a lot of times it's been hidden. It's not been talked a whole lot about. Just like Dr. Kellum here, I have a teenage daughter that has been affected by this. She's going to be 17 next week, and the whole last year of not going to school, and then going to school, and then not going to school, and then has been very trying on her. As she now moves into her senior year, I cannot even imagine what it would be like, because we didn't have to deal with anything like that in our days. My son didn't have to deal with that just 5 years ago.
But seeing what happened in my own household,
I understand very much across the board what individuals are having issues with, and they want to make sure it's covered. As you and I talked earlier,
it is such a big deal to make sure that the plan that you have has mental health, because people want to make sure that they have it.
It's not as dirty a word as it used to be. It was always hidden. Oh, I gotta go see, you saw her, yeah, she's heading over to the shrink again.
No, now it is, I just need someone to talk to. And there's nothing wrong with it.
It has affected everybody. As you mentioned, it has affected everybody in one way or another. and having mental health and having access to that, just like the graphic
that Michael P. showed, you look at the increase, even on the telemedicine side for mental health.
huge deal. Most plans now include that, and I think that's revolutionary, game changing, and absolutely essential for the insurance market.
Yeah, Dr. Machiyama, to kind of follow that, talk about the importance. I know we talked about telemedicine earlier. Virtual care, teledoc, telemedicine, easy connectivity. It's important to talk to somebody at least at the precipice when you're dealing with something. Talk about the importance of telemedicine as it pertains to behavioral issues and mental issues.
Absolutely, and I think you hit on it when you said it needs to be done early. And so here, that takes us back to us leveraging the technology that's available, and then the regulators easing up on the regulations so the general population can have access to that.
Dr. Vanquist, let me ask you a question. You talk about medical travel with everything that's going on right now. Do you see that increasing, decreasing? Your white paper says that it's increasing, but I find that hard to believe just with the fact you're about to say, Gabe, that thing was written in 2016 or something. I don't know. But when I read it, I don't understand that particular part of it. Can you talk about medical travel and if it's rising or not?
So it all has its basis in consumerization, and what we're seeing is more and more consumerization in healthcare. 1950s style was you only went to whoever happened to be in town, and that happened to be the only game in town, and that was how you handled healthcare. Now you have more choices than ever before, and this is good for the consumers. And those choices have brought with it complexity and brought a difficulty to decide perhaps who to go with and how, when to go and things of that nature. But I think overall, the idea of people deciding who they want to choose to have a relationship with as a physician, particularly primary care, what types of specialty procedures they would like to engage in, and with whom, in other words, looking at what Michael Porter from Harvard calls the value in healthcare. He wrote a book a few years back called Redefining Healthcare, where he very clearly stated we need to stop talking about healthcare in terms of cost and quality as separate constructs. It's not how we purchase a car, for example. When you purchase a car, you don't just get the cheapest car that doesn't have an engine, doesn't have a steering wheel, doesn't have tires. It wouldn't make any sense. We shouldn't think of healthcare in that way. We should think of healthcare in terms of, can we get a relatively good price for a quality procedure that I would like, or perhaps even a better quality procedure for more or for a better bundled package. And that is essentially where medical tourism comes from, is the idea that doesn't necessarily exist on your block. It doesn't necessarily exist in a couple mile radius around you. It may exist somewhere across town, may exist across the state, or potentially out of the country. And so
but that out of the country part is what I'm talking about. It seems like now with COVID-19, that's come to a stop, I would think.
So it has, and what we're seeing is that it's going to increase. There's some, the World Tourism Organization is already having some projections based on what they expect that hospitality and airlines and other things are going to, when they're going to start reopening and having it. And we're expecting a return to normalcy over the next couple of years. It's going to be a long tail in terms of COVID. There's going to be some people's behaviors that will obviously change, but the appetite for example, is the COVID going to decrease your appetite for French wines, or for getting Italian suits, or for the idea of getting a quality product or service from where it comes from, that's still going to be there. And in fact, with some of the pent-up demand that we've seen in the United States and other places regarding what we would call the elective procedures, or the things that were being restricted by the states, We're actually expecting perhaps by the end of this year or the early next year that traveling for healthcare will increase substantially.
Okay. Dr. Keller, real quick, we've got several members of the business community here. How important is it to take care of the business community from a vaccination standpoint? I mean, you and I had these conversations. Obviously, 1A and 1B was very selective on who they were giving vaccines, but you and I, at least me coming from the business world, said we've got to take care of these folks that are taking the chance to go back into the community and that are around people. How important is it that we take care of the business community?
Very, I think. I mean, being a free market guy, I certainly want that to open up. And I think it's very important that we protect places that people can go and feel comfortable with that. But really, I think it should be done in conjunction with the population as a whole. But the one thing that we see is as we hit businesses, we're able to hit 100 people, 50 people, 150 people at a time. And that is a good way for us to begin to penetrate into the population at fair numbers and really begin to effect a change, I think, a little bit more quickly. So, I mean, I think certainly we want businesses to be better because we're very pro-business. However, I think in choosing them, we are able to hit a lot of people in a relatively short period of time.
And it has a trickle effect from an economy standpoint. Michael, who I understand actually personally did all of those graphs himself last night. So good job on doing all those graphs. But as we continue to vaccinate, the economy is going to steadily start to rise because people are going to be healthier. They're going to feel better. It's almost a trickle up effect, if you will. Vaccinate, and that economy is going to come back. And you're somebody who is somewhat of a freelance economist, I guess. You always kind of look at different things outside of medicine. And as the CEO of this company, it's your job to do that. You see the economy improving. I mean, business 101. You vaccinate, you get the people back at work. They work, they make more money. It's that simple.
It is that simple, actually. A simple anecdotal story with that. What I've seen as people come in and have been vaccinated, there's been a tremendous relief that they've experienced by just getting the shots, which has created a little bit more freedom, a little more excitement to get out and return back to normal. And so I think I underestimated truly how important the vaccine was in terms of the mental health surety as opposed to just a prevention. And I think as we get more and more people vaccinated, that relief, that sense of protection, albeit with a sense of responsibility, I think people will get out and certainly do.
So we've got about 5 minutes left, and I've got one last question. I'm going to start with Dr. Machigama on the end. I'm going to work this way. Dr. Machigama, how close are we to finishing this, to getting out of this, to returning? Everyone keeps using the word normalcy. How close do you think realistically are we to being able to go to a 4th of July party?
So a friend of mine named Dr. Marty McCary, who is a Hopkins trained surgeon. He's pretty well known. He's an advisor to the former administration. He's very well written. He came out with he wrote a paper that was published I think last month or maybe January, but he said that we're about there. We're getting really close. It was a very positive paper, and so I definitely agree with him. And we see the numbers going down. He brings up a good point about cell-mediated immunity, which we understand as healthcare providers, doctors, but we don't hear about that in the media. And so that's a part of herd immunity that's happening sort of under the radar, but it's very important. And he makes the point that it's not yet all about the vaccine. We just haven't got the numbers there to give all the credit to the vaccine yet. But cell-mediated immunity is a beautiful thing, and that's half of our immune system. Our immune system has 2 branches, the antibody branch and the cell-mediated immunity branch. And so I think there's a lot of that going on, which we don't hear about in the media, but it's a beautiful thing, and I think we're getting it.
Harlan, you get your eyes and ears on the business community. What are you seeing as a small business owner? Do you see us with an upward trend in how you're doing volumes of business? Or do you see this as a flat line or still going down? What are your thoughts? And do you think we're coming out of this from a business community standpoint?
Yeah, there's no doubt we're coming out of it. People are ready to get back out there. People are ready to promote their business. People are ready to do business. And a lot of that is business to business right now, because as we're still waiting for a lot of the customers to come back into the stores, we're doing business with each other. And we're going out there and we're networking, whether that is via Zoom or in person. And this chamber is a great example of that. We're getting out there, we're talking to each other, we're getting some business done. People are ready. We're in Texas, and Texas is strong, and Texas is going to come back just like we do in the nation. We lead the nation in a lot of things, and we're ready to do it. We're ready to come back, and I know our small business community is ready to do it too.
And Texas is making it, everyone can get the vaccine started on Monday, so good stuff. Dr. Vanquist, question for you. You're in the colleges, you're out in the community. Do you see this? Do you see us coming out of this? And if so, what, just again from your standpoint, what do you see us at right now?
Yeah, so I've been following, because I follow a lot of international health trends. If you look at Sweden and their governmental policies regarding they're trying to prevent the outbreaks versus Germany versus Japan versus anywhere in the world, they're all seeing a similar type of curve, which shows that there's definitely a steady improvement in terms of not only the spread of the vaccine, slowing the spread, but also what's more important is the efficacy levels of treatment have increased significantly since the beginning. Michael, I think, touched on that as well. There's some great stuff in the literature about how our ability to treat this is better. And so as consumers, as students, as employees and businesses, we've also seen an increased understanding in being able to reduce the spread, particularly of airborne viruses, reducing the number of particulates that you're getting in certain orifices, things of that nature. So businesses have gotten better at that as well. Now they have developed standard protocols for it. So I think everything is better right now. Education is safe to go to, businesses are safe to go to, it's safe to get on an airline, things of that nature.
Dr. Kellum, I know that the sentiment is probably going to be similar, but I want you to add the caveat to that we're turning the corner on the importance of still being safe and being smart. And there's a lot of smart people in this room right now. What do you say to them that we are turning the corner, but you still have to finish that sentence for me?
Be careful and be responsible. I agree with Roger that looking at that study, I do think we're closer than not to reaching a potential herd immunity. When you look at the decline in cases, the precipitous decline in cases, the real explanation is what he brought up in that study as opposed to truly being vaccinations, although very important. I think that a lot of it's going to come back to people's comfort level, quite frankly. And so my recommendation is wear your mask if you feel comfortable with that. I think in certain establishments over time, especially establishments that have been vaccinated like our clinic, will be able to be without the mask and not have to worry so much about that. But it's going to be an individual thing. Everybody has a different level of confidence in terms of taking off the mask. And my recommendation is to wear it as long as you feel comfortable with that. I think businesses, I think hospitals, I think offices will all have protected ourselves enough to protect the people that come into our facilities. But it all goes back to the individual.
So am I going to be floating down the Guadalupe in Mosquito with a ball hat on enjoying 4th of July? He dry heaved, that's what he did. Guys, a big round of applause for our 4 wonderful panelists. I don't think that we could have gotten more out of this discussion from these 4 fantastic gentlemen. Guys, thank you so very much for doing this. One more round of applause for Dr. Roger Machagamba, Harlan Pickett, David Vanquist, Dr. David Vanquist, and Dr. Daniel Kellum. Guys, thank you so very much for allowing me the opportunity to moderate this fantastic conversation. With that, I need you to give a big round of applause to our wonderful leader, Shankar Ponsalelli. Come on up, Shankar. I made a mess. There's a lot of stuff here, so I apologize.
Thank you, Gabe. Big applause for Gabe as well. This was an excellent moderation of a not so easy topic. Okay, so just so you know, when we are done with giveaways, we do have another part, the mixer, that was sponsored by
Physicians Premier, so stay for that. I also wanted to tell you that
if you had trouble with the app and you wanted to get access to the documentation either, do email Mindy, Shaz, or myself. We'll make sure that you get that documentation and that you can network. Now we will get to the part where we give away, where we draw some names for giveaways. I have looked at the attendee list inside of the app, and I have a nice little Excel sheet with numbers and in front of rows, so it's gonna be very easy. I'm going to look here where there's my notes for the giveaways. Mindy, what is the first one? The Tri-County Chamber Golf Swag Bag, a value of $250. And I'm just gonna take the number of minutes here on my watch is 4:12, and I'm gonna go to row 12. And I have Kendra Rodriguez. Yay! There she is. Congratulations, Kendra. You are very welcome, I think, according to, let's see, are you with UIW, Kendra? Of course. Nice. Next is an Echo Dog sponsored by ZSG Zavaya, and let's see, Andrea, a number between 1 and 44, please. 44. Kim Acosta. Congratulations, Kim. Kim with Legal Shield.
You paid me the last one.
Next up is a bag with gift cards with a total value of $65 by Randolph Metrocom Rotary Club. Dr. Callum, a number between 1 and 44. 43. Debbie Zanic. Debbie, she is in Utah. I know. What should we do with that?
Take it for a win.
Take it for her, send it to her. Yeah, I'll see her every now and then. We'll get it to her. Debbie, by the way, is, I'm not sure what it's supposed to do to say that, so I won't. All right. Next up, Mad Woman Marketing, a swag bag with a gift card for Nichas. Dr. Wiequist, your number, between 1 and 44.
So go with number one?
Number one, sure. There is only an email address here that is jqe202@outlook.com. I think I'm not supposed to say that either. Another number, Dr. Wiequist.
So we'll go with 2.
2. 2 is Dr. Mochigamba. Congratulations. Then we have another bag, a swag bag with gift cards, with a total value of $65. Harlan, your number? 16 is Rebecca Lee, and she is in Toronto, so we have to mail that to Rebecca Lee. I do know she was online with us all the time, so congratulations to Rebecca in Toronto. That's the Hilton. Hilton is giving away a 2-night stay I'm sorry? Including breakfast. Very important. Because if you don't have breakfast, you can get hungry. Dr. Mochidema, what's your number? 7. April Smith. Congratulations, April. She was here, she probably had to leave, but we'll make sure that gets to April Smith with greater learning. All right, there's a few more drinks there, and I did want to mention that our drink sponsor was co-sponsor with American Dependable Therapy, so thank you very much for that. At this point, I will let Mindy say a few words, and thank you so much for all your support.
You guys thought you were going to get away with not listening to me today, didn't you? Those of you that are chamber members don't think that's funny, but our guests, you should appreciate that they did not give me the mic most of this time. Real quick, I just had a few things to say. First of all, I did want to give a big shout out to Dr. Kellum and his team. They have been working tirelessly giving out those vaccines for weeks now, all over different counties, different areas here in our Tri-County area. So please give them a big round of applause for all the hard work they do in our community. Constantly giving back to our community, and we do appreciate that. And I did want to mention American Dependable Therapy, co-sponsored with Johnson Home Health, so we appreciate the beverages from them. And Shankar, what a wonderful leader you have become. I know that you were so nervous to take the chair role. We paid him, and I promised him to back him up, but he really doesn't need as much support as he thought. So thank you so much for your leadership with Tri-County Chamber, with this event, the State of Medicine, everything that you have been doing. I appreciate it. You know, Tri-County's my baby, and this is my family, and we do appreciate everything that you do for this. And my media team, man, you guys are rocking it, making us look legit. I appreciate everything you do. Carla Rodriguez and Be Social, Izzy Morales, we appreciate everything you guys are doing. You are putting us online, live streaming, working really hard. They were here at 9 o'clock. I wasn't even here that early, so you guys are amazing. I appreciate all the hard work that you're doing, and then Andrea helping and assisting all of them is a hard job, and I appreciate all of your work with that as well. My board members who are here, some of them have left. Kevin Carpenter, who had to step away to pick up his children. Shaz Mahmood, which I think he might have stepped out. Kim Acosta, who just won. And Eric, I saw you sneak in. Anderson, you were late, so I'm going to make sure everyone knows that. And I guess I will re-mention that Gabe Farias is our outgoing chair, and he's still a part of our board. So thank you to my amazing board for everything that you guys do to support this chamber and help this event happen. They work very, very hard. Then I have to, of course, thank my diplomat team. I have Casey Tankersley. Are you still here? Casey Tankersley, she's with GVEC. She was helping at check-in. Most of you saw her beautiful face at check-in. We have Patricia Coe here from AFLEC. I think Michelle Watson with Dr. Kellum's office disappeared. And then the amazing Mitzi Delgado and Jason Delgado, they are always volunteering, not only for Tri-County, but within the community. So we do love and appreciate everything you do for us as well. The City of Live Oak, thank you for all of your continued support of Tri-County, for giving us this establishment. They donated this room for us to have this event. And hopefully moving forward with the rest of the state of Tri-County will be able to utilize this room as well. Yes, everybody's had a round of applause too. I know you guys are tired of hearing everybody speak. I just wanted to say one more quick thank you to all of our sponsors, to all of our city partners here on the banners, and obviously, of course, the wonderful speakers and panelists. My twin back there, Michael Beaver. We were born on Jesus. I just have to announce that every time we're together, and then 2 or 3 other times a year, right? And wonderful Dr. Kellum, who actually is my practitioner as well. Amazing, amazing care that I received from him. Dr. Vikos, we really appreciate you. I mean, that Facebook comment, Kevin Carpenter said something about you, and then you commented, and I was like, we gotta get this guy. And yes, you are very handsome. We had a really very handsome panel. Everybody out there is very handsome. Harlan, you know, I appreciate your continued support of Tri-County. He's been a member for years. But Tri-County is always there to support us, did not hesitate to jump on board with this. So thank you so much. And Dr. Matsugimba, again, I love the relationship with you and Shankar, and I appreciate that he was able to call on you and you did not hesitate to help us with this as well. So thank you all again for being here. And of course, all of you, our guests and our members, I really appreciate you taking half a day to come and hang out with us. I hope that you can stay just a little bit longer. Make sure that you go back outside and visit the vendor tables. There's some really cool giveaways and also some very valuable information out there. They're all healthcare related as well. And then we are offering 2 free drinks and some appetizers. Thank you to Physicians Premier ER and the Hilton Garden Inn. We will have that out there in the bar area, so be sure to join us, and that's just another opportunity for a little bit of networking and mixing. So thank you guys again. Have a wonderful rest of your day.